Hi. Good evening. Very good evening to all of you, dear student. So, we are starting this LRR for physiology, and this is for the upcoming INI-CET exam, as you know, specially designed for the upcoming INI-CET exam. So, just let me know whether I am clearly audible and visible at your end. Yes, good evening to all of you. Audible ना, आवाज़ आ रही है अच्छे से, सुनाई दे रहा है? PDF मिल जाएगा, annotated PDF you will be able to get after the session. I'll share the annotated PDF. Today only you will get. So, after getting the annotated PDF, you have to just scroll through this PDF. Okay. So, I'll write down whatever is whatever is extra needed to be written, and then you just download the annotated PDF. It will be shared and just scroll through it before your exam. Okay. Because in this session, as I told you, this is the LRR. So, if you look at the last 5 years topics of INI-CET, so you will be able to know that there are certain topics from where the questions are repeating every alternate year, and there are certain questions which are out of the box always, okay, but they rarely reappear in the exam. I mean, there are certain MCQs I will show you. Those MCQs are very, very rare. So, those rare type of MCQs you should not concentrate, but the MCQs which are coming up again and again in your exam, you should concentrate more on those, because rare MCQ means very difficult MCQ means every students are at the same level. Okay, some of them may get it correct because that's most probably a guesswork. Okay, so you don't have to think much of the very rarest of rare MCQ or the very difficult most MCQs. Try to attempt that if possible, otherwise no. But the thing is that common topics you should not make any mistakes. So that's why in this session approximates how much that's a 2.5 hour maximum, I believe, right? But it depends in between how much interaction we are doing, or how slow, how fast I am going on. So all these things are there, but 2 to 2.5 hour, that is the session. So what I am doing here, so I told you that these are the last 4 to 5 years important things I am going to discuss here, so that the must know things, the most important things you should not miss. Okay, so I have arranged this session like that of the last year session only. So last year also I had taken on this INI-CET special session. So some of the topics are same to same with the last session, and some of the topics are new because considering the change in exam pattern, considering the change in. So what I am going to do here, first of all, we are going to do some important single liner. Okay, that means this single liner are based on the previous year question only, previous year MCQs only. Okay, so we will be discussing this single liner important MCQs. So in this single liner, at least 3 to 5 years MCQs will be covered. Okay, after that, what I am going to do, we are going to discuss certain MCQs which are supposed to be difficult. They are not very difficult, but I will discuss, and you will be able to understand that those MCQs are a little bit controversial, little bit difficult one. So that we are going to touch upon. Few MCQs are there. And then you know ki in INI-CET and in Central Institute examination, this mathematical calculation in physiology is important. So we are going to also discuss certain mathematical calculation which are very common in physiology. Okay, and this mathematical calculation formula is also very simple, but in your exam you just have to think of the formula and put the values which has been given in the question, and into the formula if you put all this value, you are going to get the answer. So very simple, but it looks difficult in the exam, so that's why I kept them separately. Okay, then next is that important images. So here I have made certain changes from the last year because some new images they are asking questions. So we will be discussing important images, and at the end of the session tables and numericals. So certain values, certain number you have to remember for your exam. Those values and numbers I have included in this table. So this is basically the briefing of all those things that we are going to do here within the next 2 to 2.5 hours. Okay, so first we are going to start with this important one liner. Okay, वॉइस आवाज़ आ नहीं रहा है क्या? कम आ रहा है? अगर थोड़ा सा वॉइस को इंक्रीज कर दो, हो जाएगा। जस्ट 1 मिनट, ओके। ओके, हाँ, वॉल्यूम इंक्रीज कर रहे हैं, ओके, हो रहा है बेटा, जस्ट वेट। Okay, so now we'll start the single liner. Okay, important single liner. So important one liner or single liner. So I told you these are based on the PYQ only. So first thing, this is very common question and you know the answer, all of you know the answer. In negative feedback, infinity gain. Okay, infinity gain is for which system? So all of you know that infinity gain will be seen because the gain formula is the correction upon error. So it will be infinity when the error is 0. So if you find out a system where the error is equal to 0, then the infinity gain will be seen in that system. So all of you know that this is true for kidney. The system, which system? The kidney, and regulation of which? The kidney when it is regulating the blood pressure, and the kidney when it is regulating the blood volume. In these two category, the residual error is 0, means when kidney is giving the jimmedari or duty of regulating your blood pressure, kidney can control your blood pressure without any residual error. Means if there is change in blood pressure, kidney will correct it without any residual error, means 100% correction will be done. Same for the blood volume. If the blood volume is increase or decrease, kidney can regulate your blood volume with 100% certainty without any residual error. That's why the infinity gain is there. Okay, ठीक है. Next one, answer already you have given. So this is a very common question. Gibbs-Donan equilibrium is mainly by. So we all know Gibbs-Donan equilibrium is because of the presence of a large impermeant ion, right? So large impermeant ion, if it is impermeable through cell membrane, then these large impermeable ions are going to develop the Gibbs-Donan equilibrium. Means if such kind of ions are present in one part of the cell fluid or outside fluid, then this large impermeant ion will develop Gibbs-Donan equilibrium. So one of such large impermeant ion is protein, because we know that protein cannot pass through the biological membrane. So protein will be the answer, but large impermeant ion can also be given as an option in the MCQs, right? Next, potential developed due to free movement of. So whenever a cell is in a resting condition, there will be movement of the ion, free movement of the ion, because of the presence of certain channel. Those channels are known as the leak channel. So these are the information I have given you multiple times. Okay, leak channels. So this leak channel means those channels are remain open always, even during the resting condition also these channels remain open. So because of the presence of the leak channel, what will happen? The ions will diffuse from one part to the other part of the cell, and because of which a potential will develop. This potential is calculated by. So the potential is known as the equilibrium potential, and it is calculated by Nernst equation. So the Nernst equation is for calculation of the equilibrium potential, which is also known as isoelectric potential. Isoelectric potential. So please remember this thing, that potential which is developed due to free movement of the ion across the cell due to presence of the leak channel, the potential is known as the equilibrium potential or the isoelectric potential, and the equilibrium potential or the isoelectric potential is measured by Nernst equation. Okay. Now feed forward control system in the regulation of. So you have to remember multiple feed forward system examples. One of such famous examples is that increase in the heart rate or increase in the respiratory rate even before the start of exercise, This is a typical thing where the feed forward control system works. But also I told you that feed forward control system is also there for the thermoregulation. So thermoregulation had feedback control also, feed forward control also. In the last exam which was given, this feed forward control system, in the option they provide thermoregulation, and which part of the thermoregulation? Vasoconstriction in response to cooling. So vasoconstriction in response to cooling. This is one of the examples of feed forward control system. Okay, feed forward control system, right? So thermoregulation, you must have to remember, I told you thermoregulation means feedback and feed forward, both are there. Increase in heart rate, increase in respiratory rate even before the startup exercise, typical feed forward control system. Apart from that, you have already given some examples, that the cephalic phase of gastric secretion, that is known as the cephalic phase of gastric secretion. So cephalic phase of gastric secretion as well as the receptive relaxation. Okay, so cephalic phase of gastric secretion as well as the receptive relaxation of the stomach, receptive relaxation of the stomach. So receptive relaxation means relaxation of the stomach even before the food is reaching in the stomach, that is the receptive relaxation. So along with the thermoregulation, you have to remember the cephalic phase of gastric secretion, that is the salivation when the food is salivation is the cephalic phase of gastric secretion, means secretion in the stomach when the food is inside the mouth, that is the cephalic phase of gastric secretion. Plus receptive relaxation of the stomach is also an example of feed forward control system. ठीक है? Okay. अब ये जो next question, some of you are already answering basolateral, some of you are answering apicolateral. So this was one of the question which is a little bit controversial. Tight junctions are primarily located in, but it should not be any controversy. It should be apical answer only, apical only. It is not the lateral part. Tight junction is not the lateral part. It is at the junction between apex and lateral, but the tight junctions never crosses the apical margin. Apical margin को cross करके it never comes to the lateral margin. Okay, so the answer will be apical. So if you look at these two books, the books we generally follow because the most of the questions are INI-CET is basically given from these books. So Guyton's and Hall's of textbook of physiology. Here it has been already written that tight junctions between the apical border of the epithelium cell. So where the tight junctions are located, it is the apical region of the cell, at the border of the apical region. That does not mean it is a coming onto the lateral border also. So apicolateral or apical, if you have to choose only one answer, apical will be the better. Same for the Genong, tight junctions characteristically surround the apical margin of the cell in the epithelial. Nowhere it is written it is crossing to the lateral border of the cell. So there is a junction between lateral and apical border. Tight junctions always remain in the apical border, not it is crossing the lateral border. So apicolateral, although it seems good option, apicolateral, but that should not be the answer of the questions. Apical will be the answer. Got it? Okay. So now next question, highest frequency of BER. I believe all of you know the answer. Duodenum will be the answer. Okay. Duodenum greater than jejunum will be the answer. Later on I will show what is the actual rate. For the duodenum the rate of the BER is 12, for the jejunum the rate is 11. So this is very simple. Now the slow wave is generated by, slow wave is nothing but the BER, basal electrical rhythm, and all of you know that this is generated by which cell? The interstitial cells of Cajals, right? Interstitial cells of Cajals. Okay. So which one you are answering? Yes, cecum has the minimum rate. Okay, duodenum has the maximum rate and jejunum followed by jejunum, and cecum has the minimum rate. I will show you the actual rate in the image based type of question. So I believe you also know the second question answer. The slow wave is also known as the basal electrical rhythm and it is generated by interstitial cells of Cajals. Okay. Next question, highest concentration of potassium. Question answer is colorectal fluid, colon rectal fluid. Colon rectal fluid is the answer of this question, that highest concentration of the potassium. But there is parallelly another question, this is very frequent, okay, MCQ, that total amount of potassium secreted by which gland, then your answer is saliva, salivary secretion. Okay. So if the question is total amount of potassium, maximum amount of potassium is secreted by which gland, then the question is asking about the total secretion of potassium in one day, in 24 hours, then your answer will be salivary gland. But whenever the question is asking about the concentration, C for C, it is the colorectal fluid, C for C. Okay. Okay. Next question answer you have given correctly, that migratory motor complex reappear at which interval? Answer is 90 minutes. Some of the books are saying 90 to 120 minutes, but 90 minutes is the better answer. Okay. Now for the migratory motor complex, certain important information are required to be remembered because this is a frequent topic in INI-CET exam particularly. So migratory motor complex, there are multiple phases. So migratory motor complex, you know where from it will start from the middle part of the stomach. It will start from the mid part of stomach. then it will move from mid part of the, so there is a strong contraction which will move from mid part of the stomach up to the level of the duodenum, okay, it will go to the jejunum, followed by it will go to the terminal ileum, and at the level of terminal ileum it will be finished. So, if you look at the time interval between these two onset of activity, so in this diagram what is this? These are nothing but the contractile activity of the GI smooth muscle. So, this contractile activity is a strong contraction and it is the MME, that is a migratory motor complex, MMC, a migratory motor complex or migrating motor complex, whatever. So, one migratory motor complex has been appeared, and then here is the second migratory motor complex. If you look at the time interval between these two, that interval is the 90 minutes interval, right, 90 minutes interval. And if you look at this different parts of this GIT, so what is happening, the same kind of electrical activity is moving from, sweeping from one part to the other part. So, the sweeping movement of the strong contractile activity from one part to the other part is migratory motor complex. It can also be given as an image based question. So, ये right side में जो image देकर रखा है, try to look at these images, okay. So, there will be a clear gap between these two activity. So, this is one migratory motor complex, this is another migratory motor complex. The interval between these two migratory motor complex onset will be 90 minutes, okay. It's a housekeeping motility, all of you know, and I told you that this is the motility which will appear in fasting. How much fasting is required? At least 90 to 120 minutes fasting is required for the onset of migratory motor complex. And this hormone name is also very important, migratory motor complex initiation and control. Initiation of the migratory motor complex as well as control of the migratory motor complex is done by motilin hormone. And I believe in pharmacology you have read one antibiotics, the macrolide antibiotic, particularly the erythromycin group of antibiotic is an agonist of this motilin hormone receptor. So, that is why they causes onset of GI contraction, okay. So, that also you have to remember, okay. Macrolide antibiotic erythromycin is the agonist of this motilin hormone receptor, okay. So, this is all about migratory motor complex. Then next one, resting membrane potential of cardiac muscle, I believe all of you know the answer. So, this is 90 millivolt. Don't confuse with the nerve RMP. So, RMP of the neuron is minus 70 millivolt and RMP of the myocardium is minus 90 millivolt. Same for the skeletal muscle, okay. So, this minus 90 millivolt is also the RMP for the skeletal muscle. These two things you have to remember, okay. उसके बाद नेक्स्ट क्वेश्चन, नॉर्मल AV नोडल डिले. सो द रेंज इज 60 to 125 millisecond, 60 to 125 millisecond, but on an average value this is 100 millisecond. So, this 100 millisecond time duration you also have to remember 0.1 second or 100 millisecond, okay. Whatever you want to remember, it's okay, but it's generally 100 millisecond or 60 to 125 millisecond, right? That is the average duration, okay. On an average 100 millisecond is the time duration, okay. Electromechanical systole. So, first there will be electrical activity of the ventricle and then there will be mechanical activity of the ventricle. So, electrical activity of the ventricle start from the QRS complex. So, the Q wave start means that is the starting of the electrical activity of the ventricle, and after the electrical activity the mechanical activity of the ventricle will start, and the mechanical activity or the contraction of the ventricle will stop when the second heart sound is heard, means whenever there is a closure of the semilunar valves, that is the ending point of the systole. That means from the Q wave onset up to the S2 sound, this duration, if you take the duration from the onset of the Q wave up to the S2 heart sound, then this duration will be known as the electromechanical systole of the heart. So, this duration I will show you when we are discussing the Uyghur's diagram. So, I have kept one image of Uyghur's diagram. So, there you will be able to find out this QS2 duration. So, you have to measure the duration from onset of the Q wave up to the S2. So, that total duration is known as the electromechanical systole of the heart, okay. Now, main site of peripheral vascular resistance, I believe all of you know that the vessels which is known as the resistance vessels. So, what is the answer? Arterioles is the answer. Arterioles is the answer of the main site of peripheral vascular resistance, okay. Next question. Next question, इसका आंसर क्या है? Carotid sinus baroreceptor is most sensitive to. What is the answer of this question? So, इसका answer, anybody? Someone you have given hypoxia. Now, it's baroreceptor, not the chemoreceptor, okay. chemoreceptor होगा तो कार्बन डाइऑक्साइड आंसर होगा. हाइपोक्सिया इज द प्राइमरी स्टिमुलस. क्वेश्चन पढ़ो यार, baroreceptor क्वेश्चन देके रखा है. आप हाइपोक्सिया बोल रहे हो। बैरोरिसेप्टर क्वेश्चन है, बैरोरिसेप्टर, कैरोटिड साइनस बैरोरिसेप्टर इज मोस्ट सेंसिटिव टू, ओके, कैरोटिड बॉडी केमोरिसेप्टर होता है, बैरोरिसेप्टर पूछा है ना, कैरोटिड साइनस बैरोरिसेप्टर इज मोस्ट सेंसिटिव टू व्हिच ब्लड प्रेशर? Baroreceptor means it will sense the blood pressure. It is not going to send the chemical signal. It's not chemoreceptor, okay. But which blood pressure? That is the question. Which blood pressure? Decreased blood pressure? Ekdam na. Baroreceptor will be activated when the blood pressure increases, not decreases. Increase of which blood pressure? Systolic हो सकता है, diastolic हो सकता है, but question is most sensitive to which blood pressure? Your answer will be very, very different. Pulse pressure will be the answer, greater than mean arterial pressure, okay. This is a very common belief that mean arterial pressure, baroreceptor is most sensitive to mean arterial pressure, but what I told you, you have to remember it is not the mean arterial pressure, it is the pulse pressure where the baroreceptor is most sensitive. So whenever the pulse pressure is changing, the baroreceptor will be most sensitively stimulated, mostly stimulated. If there is increase in mean arterial pressure also, then also baroreceptor will be stimulated, but most sensitive question ka answer is pulse pressure. If you don't believe, then look at this is the cutout I have taken from Genong textbook of medical physiology, I told you. So here it is clearly written that the receptor, this receptor, carotid sinus and aortic arch baroreceptor, depressor baroreceptor. Why depressor? Because whenever your blood pressure is high, baroreceptor is going to decrease your blood pressure. So this is most sensitive to change in pulse pressure, but also respond to change in mean arterial pressure. So please don't make confusion here, don't trust any other source. Okay, Genong में देखे रखा है कि, तो that is the question. So mean arterial pressure is not the answer, baroreceptor is most sensitive to pulse pressure followed by mean arterial pressure, okay, don't make mistake. Now next one, reflex responsible for tachycardia during right atrial distension. So when the right atrium is distended, there will be stimulation of brain bridge reflex, BBR, brain bridge reflex, and the brain bridge reflex is responsible for causing tachycardia. But not only that, whenever there is right atrial distension, okay, not only the brain bridge reflex will be activated, there will be also increased secretion of ANP hormone, that is the atrial natriuretic peptide hormone will be secreted, and there will be decreased secretion of ADH hormone. So these two things you also have to remember. So right atrium is connected with the hypothalamus also, okay. Whenever the right atrium is distended due to, suppose you have infused blood to a person, you have infused huge amount of normal saline to a person, so right atrium will be distended because venous return is ultimately going to return in the heart. So whenever the right atrium is distended due to any reason, there will be decreased secretion of ADH, okay, because this ADH decreased secretion is ultimately going to excrete the water, and there will be also increased secretion of ANP, atrial natriuretic peptide. Along with that, brain bridge reflex will also be activated. Brain bridge reflex is going to cause tachycardia, right? And I believe you also remember Bajol-Gerry's reflex. Bajol-Gerry's reflex सब कुछ कम हो जाएगा. Bajol-Gerry's reflex means, so in case of Bajol-Gerry's reflex, there will be decrease in blood pressure, there will be decrease in heart rate, okay. Along with that, there will be apnea followed by hyperventilation. Along with that, there will be coronary vasodilation. There will be coronary vasodilation. So all these things you have to remember about Bajol-Gerry's reflex, okay. Yes, that is due to chemical serotonin, capsaicin, veratridine. ये तीनों chemical का नाम याद रखना होता है. Serotonin, capsaicin, veratridine. These three chemical at least you try to remember, okay. Next question, ANREF effect. So ANREF effect, already this is a question which has been asked in INI-CET. So I believe you know this thing. So this one Bowditch effect and this ANREF effect. So Bowditch effect is increased heart rate is increasing the force of contraction of the heart. Increased heart rate is increasing the contractility of the heart. Contractility increase हो रहा है, increase heart rate. So whenever there is increase in heart rate, it is causing increased contractility of the myocardium. That is your Bowditch effect. But contractility can also be increased if there is increase in afterload. So afterload is what? Afterload is the aortic pressure. Mean aortic pressure is the afterload. So Bowditch effect is saying that if there is increase in heart rate, force of contraction of the heart will also be increased. Our Andreeff effect is saying that even if there is increase in aortic pressure, heart has to pump more forcefully, otherwise it is not going to eject the stroke volume. So, contractility of the heart will also increase if there is increase in afterload. So, that is known as the Andreeff effect. And along with that, never forget about the Frank-Starling law. Frank-Starling law is saying if there is increase in preload, okay, what is preload? Preload is the end diastolic volume. If there is increase in preload, then also the contractility increases. So, increased preload is also increasing the contractility. That is what Frank-Starling law. Increased heart rate is increasing the contractility. This is your Bowditch phenomena. Increased afterload is increasing the contractility. That is your Andreeff effect. So, these three effects very important for INI-CET question. Try to remember every one of them. Okay. So, preload means I told you that is the end diastolic volume. Afterload means I told you that is the aortic pressure, mean aortic pressure. So, these two things also asked as a separate question, that what is the best index of preload, what is the best index of afterload. जैसे कि यहाँ पे क्वेश्चन के रखा है बेस्ट इंडेक्स ऑफ आफ्टरलोड, आपका आंसर होगा मीन आर्टेरियल प्रेशर. बट इफ द क्वेश्चन इज व्हाट इज द मोस्ट important determinant, I told you repeatedly what is the most important determinant of this afterload, your answer will be TPR, total peripheral resistance. Okay, total peripheral resistance. So, sometimes this mean aortic pressure may not be given as an option. If mean aortic pressure is not given as an option, then you are going to choose the TPR, total peripheral resistance. Otherwise, if both are given in the option and if your question is best index, then your answer is mean aortic pressure. But if the question is most important determinant, then your answer is total peripheral resistance. Okay, so single line but important information, try to remember them. Okay. Now, glucose absorption, okay, glucose transporter, okay, glucose transporter present on the apical membrane of the PCT. So, here this apical is very important. Okay, try to remember that apical membrane में जो transporter होता है, and that is also at the level of the PCT, proximal convoluted tubules. So, all of you know that this is the SGLT2. But the second question, percentage of glucose absorption in the proximal tubule, PST. So, here the late proximal tubule, that is the proximal straight tubule. This is a different question. So, here your answer will be 10% and this glucose reabsorption is done by SGLT1 type 1 transporter. So, please remember that proximal tubule has two parts. Proximal tubule has two parts. One is the proximal convoluted tubule and second one is the proximal straight tubule. It is for 90%, it is for 10%. Here it is SGLT2 and here it is SGLT1, right? But both the SGLT1 and SGLT2, whatever, they are located in which membrane? They are located in the apical membrane of the cell. Apical membrane means membrane which is towards the luminal side. But if the question is which transporter is located on the basolateral membrane which is located on the capillary side, okay, then your answer will be for the proximal convoluted tubule. Here this is GLUT, GLUT2, and for SGLT1 this is GLUT, GLUT1. Means if this GLUT2 is there, so GLUT2, I mean if the SGLT2 is there on the apical membrane, तो basolateral में GLUT2 होगा, and apical में SGLT1 होगा तो basolateral membrane में GLUT1 होगा. So this is a very simple thing you have to remember for glucose absorption in the kidney. And whenever the question is glucose absorption in the intestine, there SGLT1 is located, SGLT1, and on the basolateral aspect GLUT2 is located. So, little confusing because whenever the GIT is coming, okay, for GIT you have to remember, for GIT GLUT, which GLUT? Okay, I told you that for GIT apical membrane will be SGLT1 and for basolateral membrane there will be GLUT, but this GLUT is GLUT2. Okay, so here my vote is in Delhi vote. Okay. So, in the late PCT of the kidney, luminal concentration increases for which ion? I believe you know the answer of this question. Answer is chloride, because you know whenever there is filtration of every molecule in the glomerulus, Bowman's capsule, what will happen? The sodium will be reabsorbed along with the other solute in the proximal part. So, that is why chloride will left behind, and the chloride will be reabsorbed in the later part of the proximal tubule, because of which there is a question that which concentration of the which concentration increases in the late part of the late PCT, your answer is chloride and concentration increases a little bit. Now, macula densa is formed by which part of the nephron? I told you repeatedly this thing, that this is not the DCT, forget about DCT, it is the junction between, TAL, thick ascending limb of loop of Henle. It is the junction between thick ascending limb of loop of Henle with DCT, means it is not part of the DCT, it is a junction between TAL and DCT. आप बोलोगे कि sir, suppose both are given in the option, TAL and DCT both are given in the option, then your answer will be TAL. So, if this junction option is not given, then your answer will be uppermost part of thick ascending limb of loop of Henle is the macula densa cell. It is not the DCT, because I told you repeatedly in every session that macula densa cell means in the apical membrane they has a transporter. What is the transporter? That is NKCC. NKCC, the transporter which is blocked by furosemide diuretics, and all of you know that this NKCC transporter is selectively present in which part of the nephron? Thick ascending limb of loop of Henle. So, that is why macula densa cell also having this NKCC transporter, and they are part of the thick ascending limb of loop of Henle, not the DCT. Okay? But the better answer is junction between, thick ascending limb of loop of Henle and DCT is the better answer. Okay? But if it is not, TL will be the answer. Yes, mutation of this is Bartter syndrome, all of you know that. So, erythropoietin act on which cell series of the RBC production? Okay, so erythropoietin act on the erythropoiesis, it stimulate the erythropoiesis. Question was, it stimulate the which cell stage of the erythropoiesis. Okay, so there is a series of cell division during erythropoiesis. Erythropoietin has specially act on which cell? Your answer will be, क्या आंसर होगा बताओ? थोड़ा सा सांस लेते हैं, आप आंसर बताओ. एरिथ्रोपोइटिन एक्ट ऑन, नॉट GMCSF, वहाँ पे एक्शन नहीं है इसका. BFU में है एक्शन, बट दैट इज नॉट द आंसर. येस, दैट इज द CFU. ओके, CFU is the answer. CFU is the answer of this question. Colony forming unit, CFU of erythroblast. That is the answer. Okay, BFU, it has action. So now look at. So this is the images taken from Winto's hematology textbook. So here you can find out hematopoietic stem cells. Okay, common myeloid progenitor, myeloid erythroid progenitor. Then it is a burst forming unit, colony forming unit, then pro-erythroblast, basophilic erythroblast, polychromatophilic, ortho, reticulocyte and erythrocyte. So this is the series where the RBC production is happening, erythropoiesis is happening. This Winthrop textbook is clearly saying that erythropoietin act on BFU, burst forming unit. So erythropoietin action is starting from here and it has action ending at this cell stage, means all this cell will be stimulated by erythropoietin. But the book is also saying that the maximum density of this erythropoietin receptor is found in colony forming unit and the transition from colony forming unit to pro-erythroblast. That is why the main action of this erythropoietin is on colony forming unit erythroblast, not the burst forming, although the starting of the action has started at the burst forming unit. So, if the earlier stage is RAGS, then also earlier stage में action नहीं है. So, erythropoietin is not going to act here, although we say the erythropoietin acts on the stem cells, but according to this textbook the erythropoietin has no action on all of this cell. Stem cell हम लोग बोलते हैं, but not at this level of stem cells. Action starts from here and action ends here, and it also clearly says that there is no receptor for erythropoietin in these two cells. That means reticulocyte as well as mature RBC, there is no receptor for the erythropoietin. So, earliest action starting obviously colony forming burst forming unit में शुरू हो रहा है. Okay, action शुरू हो रहा है burst forming unit से, but maximum action depends on how many receptors are there on this cell, and that is colony forming unit is the answer. Got it everybody? Right? Okay, chalo. Next question. Maximum airflow resistance is seen in which part of the respiratory system? So, maximum airflow resistance is seen in, okay, lobar or segmental bronchi, lobar or segmental bronchi. Okay, that is also known as the medium to large size bronchi, medium to large size bronchi, large size bronchi. Okay, And you know there is a separate classification which is known as the Weibel's classification. So according to the Weibel's classifications, Weibel's division number 3 to 4, 3 to 5, sorry, 3 to 4 to 5 or 3 to 5 division is the answer of this question. So anything can be given as an option. So you have to remember कि if the size basis पे देख रखा है तो साइज बेसिस पे देख के रखा तो लोअर और सेगमेंटल ब्रोंकाई कैन बी आंसर, मीडियम टू लार्ज साइज ब्रोंकाई कैन ऑल्सो बी आंसर, और वेबल्स डिवीजन 3 to 5 कैन ऑल्सो बी आंसर. ओके, ये क्या आ रहा है? Okay, then is the ventilation perfusion ratio is maximum at, I believe you all know the answer of this, correct answer of this question. So this is nothing but the apex, but please try to remember that if the question is ventilation is maximum at, ventilation is maximum at, इसका आंसर क्या होगा? Ventilation is maximum at base greater than apex. So ventilation is maximum at base, and perfusion is also maximum. Perfusion is also maximum at base than apex, base than apex, but whenever you take the ratio is maximum at the level of apex. Okay, so these are the like lines which you have to remember at your fingertips. There should not be any mistake in all of these questions. सुसाइड बोलते हैं कि एक रिपीट क्वेश्चन आपने INI-CET में मिस करके आया तो सुसाइड हो गया, एग्जाम में बैठ के सुसाइड करके आ गया बेसिकली आपका. ठीक है, सो रिदमिसिटी ऑफ रेस्पिरेशन इज मेंटेन बाय, रिदमिक respiration is maintained at the level of pacemaker of respiration, pacemaker of respiration. Now previously the concept was that the pacemaker is located at the DRG center, but that concept has been changed for the last 5 to 10 years, but some of the regular textbook has not been updated yet. The answer of the location of the pacemaker is VRG, ventral respiratory group of neuron, ventral respiratory group of neuron. There is a part of the ventral respiratory group of neuron that is known as the pre-Bodzinger complex, pre-Bodzinger complex of neurons. So please remember, even if the pre-Bodzinger complex is not given, then your answer is also VRG, ventral respiratory group of neuron. Okay, ventral respiratory group of neuron, not the DRG. DRG is only the sensory integration center. The concept has been changed already. Okay, now anatomical dead space is calculated by, क्या आंसर होगा इसका? Anatomical dead space is calculated by, yes, very good, इसका आंसर होगा single breath nitrogen washout method, nitrogen wash out method. Single breath nitrogen washout method is also known as FOW LERS, Fowler's method. Okay, this is also known as the Fowler's method. Okay, but I believe you also remember that this nitrogen washout method can also be used to measure the residual volume. I believe you also remember that. So this single breath nitrogen washout method is used for measuring the anatomical dead space. Okay, anatomical dead space, but nitrogen washout method, not the single breath, that is the multiple breath nitrogen washout method, but the method is nitrogen washout method. So nitrogen washout method is also used to measure the residual volume, that you also have to remember. Okay, for closing volume also this is also used. Okay, so for closing volume also it is also used. Okay, closing volume, closing capacity. Okay, so ultimately if you are measuring the residual volume, so obviously FRC, TLC can also be measured with that. So because residual volume is a part of the FRC and TLC, so I believe you know that thing. Okay, chalo. Now next question, damage to the pituitary stalk during surgery causes increase in which of the following? So this is very simple question. So prolactin will be the answer, PRL, because you know prolactin under the negative or inhibitory control from hypothalamus, and that inhibitory factor is dopamine. So dopamine is normally known as the prolactin inhibitory factor, PIF. So whenever the pituitary stalk is cut, this dopamine will be not able to control the anterior pituitary, so prolactin level will be increased. Hormone which are or is, so this is a little bit tricky question which has been asked in INI-CET, and in the option mostly you have written the prolactin, but apart from prolactin you also have to remember that for growth hormone also there is an inhibitory control from hypothalamus. So prolactin obviously the answer of this question, but apart from prolactin the growth hormone also has some inhibitory control from hypothalamus, and that is mediated by somatostatin. Okay, somatostatin. So growth hormone is mainly stimulated by hypothalamus, that is a growth hormone releasing hormone. which is secreted from hypothalamus, and that stimulate the growth hormone secretion. But question here is which of the hormone has inhibitory control from hypothalamus? So growth hormone also has some inhibitory control, and that is by somatostatin. So that's why both prolactin and growth hormone will be the answer. So you look at the options, if both are there, so that is the best choices. If both are not there, then prolactin is the single best choices. Okay. Which hormone has permissive role in puberty? This is a very frequent question, already 2-3 बार आ चुका है. लेप्टिन विल द आंसर, एंड लेप्टिन लेके और भी कुछ रिसेप्टर लेवल पे याद रखना होगा जो हम ऑलरेडी हैव गिवन इन द टेबल फॉर्मेट. सो लास्ट में आपको पता लग जाएगा कि लेप्टिन का रिसेप्टर भी आपको ध्यान रखना होता है. ठीक है. सो दीज आर द थिंग इंपॉर्टेंट फॉर वन लाइनर. नाउ नेक्स्ट क्वेश्चन, a patient has come to the OPD with fever. Okay, which area of the hypothalamus is active in this patient? So here you think of the thermoregulatory system. Thermoregulatory system हम लोग क्या बोलते हैं कि hypothalamus में there is an anterior nucleus of the hypothalamus and there is a posterior nucleus of the hypothalamus. So anterior nucleus and posterior nucleus. Posterior nucleus of the hypothalamus, it gives response to cold. Okay, it is for response to cold environment. So response to cold environment means जो shivering होता है, shivering response होता है, that is due to the activation of the posterior hypothalamus. And anterior hypothalamus, it is the center which responds to hot environment. Hot environment means जो आपका vasodilation होगा, जो आपका sweating होगा, all of this thing is due to the anterior hypothalamus. But the question here is not between these two. Okay, although it is related to high thermoregulation, but question here, the person is suffering from fever. So what is the basic pathophysiology of the fever? Okay, answer is anterior. Okay, but question here is not about the normal thermoregulation. So these two center are there. Therefore, the normal thermoregulation, if you exposed in the hot environment, so your anterior hypothalamus will be activated and it will causes vasodilation and sweating. Okay, and if you respond to a cold environment, your shivering will happen. That is the response of the posterior hypothalamus. But here the question is about fever. What is the pathogenesis? We all know that pyrogens. Okay, fever is created by pyrogens which stimulate the set point region of the hypothalamus, and whenever the set point of the hypothalamus is stimulated, what will happen? The rise of body temperature, there will be increase in body temperature, and this is the basic mechanism of fever. So pyrogen is acting on the set point of the hypothalamus, and that is rising the set point of the hypothalamus. So that's why body temperature is rising. Yes, interleukin is one of the pyrogens. Okay, so question here they are asking that where this set point, at which location of the hypothalamus this set point is located. Again your answer is preoptic nucleus of anterior hypothalamus. So the same anterior hypothalamic nucleus which is responsible for response to hot environment, the same nucleus is also the set point of the thermoregulation. So that's why answer of this question is preoptic nucleus of hypothalamus is the set point of the hypothalamus. So answer here is anterior hypothalamus, the preoptic nucleus. ठीक है, क्वेश्चन थोड़ा सा डिफरेंट है, थर्मोरेगुलेशन का डायरेक्ट क्वेश्चन नहीं है, फीवर का पैथोलॉजी का क्वेश्चन है. फीवर इज राइजिंग द सेट पॉइंट, वेयर द सेट पॉइंट इज लोकेटेड, दैट इज द क्वेश्चन हियर. ओके, उसके बाद फीवर होगा, उसके बाद वो पोस्टीरियर hypothalamus will be activated and it will causes anterior hypothalamus will be activated, it will causes sweating and vasodilation. That is the later on reaction, but set point will be raised. Set point is located in preoptic nucleus of hypothalamus. Okay, now next question is in an awake portion. Okay, very good. Normal awake person at rest with eyes are closed. So when the eyes are closed, which wave will be seen? Alpha waves. Okay, and whenever the eyes are open, what will happen? Which wave will be seen? That is a beta wave, right? So in response to opening of the eyes, which wave will be decreased significantly? The alpha wave will be decreased in number. Alpha will be decreased because alpha will be converted into beta wave, and this phenomena is known as the alpha block phenomena. We will be discussing this with image based question. Alpha block phenomena, which is also known as desynchronization phenomena in EEG. Alpha block phenomena, right? So question is EEG waves that are reduced on opening the eye. So whenever I am opening my eyes, beta wave will be seen. So alpha wave number will be reduced, beta wave number will be seen. Okay. Next question, static 2-point discrimination. Repeatedly I told you answer of this questions will be Merkel's disk along with the means nuts, both are required, okay, because there was multiple question from here. One question, if only option you have to choose, then your best answer for 2-point discrimination or static 2-point discrimination, whatever, answer is Merkel's, because Merkel's का जो receptive field होता है, receptive field is smallest for Merkel's. That's why without Merkel's, the 2-point discrimination is best for Merkel's. Why Misnards is also included here? Because the maximum density of tactile receptor which is present in our body, which is present in our skin, is Misnards. So both Merkel's and Misnards are required, but if you have to choose single best answer, Merkel's is the answer. Okay. Brain region primarily associated with processing of the explicit memory. All of you know the answer of this question. Hippocampus is the answer. Hippocampus is the answer. Hippocampus का जो CA1 area होता है, CA1 area, this is the area which is responsible for this processing. Now here I have kept this slide. Why? Because you have to remember minimum about this explicit memory or declarative memory. Explicit memory is the memory of the word, memory of the rules, memory of the language. If I ask you what happens in your first day of the medical college when you admitted in the MBBS, what happens to on the first day of your college? So you have to think, you have to activate your brain region, and then you will be able to recall those memory. So which part of the brain region will be activated? Hippocampus and the medial temporal lobe. So this is the main brain area which is responsible for processing of explicit memory. And implicit memory means, or declarative memory means, it does not require the active processing at the level of hippocampus. It is a kind of automatic memory. Okay, automatic memory means what is remembering how to brush your tooth in the morning. We don't have to think that I have to brush the inner side, outer side. Automatically the brush is going here and there and you are brushing your teeth. So that is the kind of implicit memory or declarative memory. Got it? Okay. Now next thing is that neurotransmitter released by inner hair cell during depolarization. So organ of corti का question है. So answer will be the excitatory neurotransmitter glutamate. Okay. Next is the endocochlear potential. The potential of endocochlear potential. Endocochlear potential is plus 80 to plus 85 millivolt, plus 80 to plus 85 millivolt, right? Sensation detected by Pacinian corpuscle. Multiple times the question has appeared in the MCQ. So either the vibration will be the answer. If the vibration is in the choices, the vibration is the best answer. But along with that, deep pressure can also be answered. Deep pressure, not the superficial pressure. Deep pressure is the answer of this question. Okay. First vibration, yes, exactly. First vibration, because vibration can also be detected by Misnards. Okay. Now the same question, discriminatory touch, we have already discussed that Merkel's is the answer. Merkel's is the answer, greater than Misnards. Okay. So 2-point discrimination or discriminatory touch. Without external cues, the duration of the sleep-wake cycle. So the sleep-wake cycle, it basically follow a circadian rhythm. Circadian rhythm. So the circadian rhythm has a normal duration of 24.15 hour, but because of the presence of this suprachiasmatic nucleus, because of the presence of this external cues, because of the presence of this suprachiasmatic nucleus, the circadian rhythm has a perfect duration of 24.0 hour. So whenever you remove this external cues, okay, so if you remove this external cues or if you remove this suprachiasmatic nucleus, what will happen? This 24-hour cycle duration will be increased. It will be increased to 24.15 hour. Okay. So this is an old question of AIIMS entrance examination. Maybe it can be repeated in your exam also. So try to remember. Okay. And the last slide, I believe. Okay. Golgi tendon organ senses. So all of you know Golgi tendon organ. Okay. It senses increased tension. If there is increased tension at the level of muscle tendon, not the stretch, okay, not the stretch. Stretch should not be the answer. Stretch होने से muscle का length भी बढ़ता है ना, so stretch is the indirect stimulus for the muscle spindle. Okay, if there is stretch of the muscle, there is increase in length of the muscle. The increased length of the muscle is a stimulus better for the muscle spindle. So better answer is T for T. Golgi tendon organ are the best stimulus is the increased tension at the level of tendon. In skeletal muscle, DHPR-RYR, DHPR-RYR, skeletal muscle, whenever the answer is skeletal muscle, you have to remember that in skeletal muscle it is mechanically connected. Better answer is electromechanical coupling, electromechanical nickel. If the electro word is also not there, mechanical simple can also be answered, but if electromechanical is given, then electromechanical combine is the best choices, because without electrical activity mechanical coupling cannot happen. That's why the symbol term that is used for this coupling is electromechanical coupling. But I believe you also have remembered that for cardiac muscle this kind of coupling is known as the electrochemical coupling, and for the smooth muscle the coupling is known as the pharmacomechanical coupling. Pharmacomechanical coupling. Okay, pharmacomechanical coupling is the answer. Now, Rensa cell inhibition, which type of inhibition this is? Suppose Rensa cell inhibition question, okay, positive feedback, negative feedback, feed forward, okay. If this is the answer, so your answer will be Rensa cell inhibition is a kind of negative feedback, okay, negative feedback. Generally हम लोगों का feed forward answer आ जाता है, but feed forward is seen at the level of cerebellum. Cerebellum circuit is feed forward. At the level of spinal cord, Rensa cell is located. The neurotransmitter of the Rensa cell is negative neurotransmitter, that is glycine, some of you have written, and the feedback mechanism which is operated by this Rensa cell is known as the negative feedback inhibition. This is also known as the recurrent inhibition. This is also known as recurrent inhibition, okay, recurrent inhibition. So, these two words just you try to remember. So, the Rensa cell inhibition is a kind of recurrent inhibition, Rensa cell inhibition is a kind of negative feedback inhibition, okay. Next question, all of you know the answer. Physiological mechanism behind transcutaneous electrical nerve stimulation, it is nothing but the gate control theory of pain. Gate control theory of pain, very good. Gate control theory of pain. A beta fiber stimulation means A beta fiber, whenever it is stimulated, it blocks the gate of the pain pathway. It blocks the gate of the pain pathway. So, A beta fiber stimulation means it will block the gate of the pain pathway. That is the gate control theory of pain, okay. During muscle contraction, detachment of the myosin head is done by adenosine triphosphate. So, here you have to remember a little bit about this muscle contraction ka sequence, because multiple times this question is coming. So, whenever the skeletal muscle is in resting condition, the myosin head, if you look at this diagram, this is the myosin head, okay, this is the myosin head. This myosin head make an angle with the myosin neck. So, this is head, this is neck. The head neck angle is 90 degree, head neck angle is 90 degree. So, this 90 degree can also be an MCQ, head and neck angle is 90 degree. So, in resting condition, when the muscle is relaxed, the head neck angle is 90 degree, and along with the myosin head, which molecules are attached? Your answer is adenosine diphosphate and inorganic phosphate. These two molecules are attached with the myosin head. So, as you can find out in this diagram. Now, whenever the calcium is present in the cytoplasm, I told you repeatedly that calcium means there will be attachment, and that attachment is known as the cross bridge formation, cross bridge state. So, actin myosin attachment stage is known as the cross bridge formation. So, for the muscle contraction means cross bridge formation has to happen, and cross bridge formation will happen whenever the calcium, free calcium is present in the cytoplasm. Now, after the cross bridge formation, there will be a power stroke generation. So, the next step is the power stroke generation, where the myosin head will pull the actin, and that is the actual muscle contraction. So, myosin head is pulling the actin towards the center, that is power stroke. For the power stroke, what you require? You require the phosphate molecule to be removed from the myosin head. Phosphate molecule to be removed from the myosin head will causes the power stroke. So, this can also be asked in the future. For the power stroke, I told you that adenosine diphosphate and inorganic phosphate both remain attached with the myosin head in resting condition. From these two molecules, whenever the inorganic phosphate is removed, power stroke will happen. And after power stroke, what is going to happen? The adenosine diphosphate molecule is also going to be removed from the myosin head. So, it is also removed from the myosin head, and whenever the adenosine diphosphate is removed, which molecule is going to be attached? Adenosine triphosphate is going to be attached, and whenever the adenosine triphosphate is attached, there will be released of the myosin head. This released is known as the detachment of the myosin head, detachment of the myosin head, and this is the MCQ. The detachment of the myosin head require which molecule? Adenosine diphosphate molecule. And after the detachment, again there will be reattachment, but before that it will again convert it into a resting stage. After the resting stage, again it will go for the power stroke generation. Okay, so this is the sequence which is known as the cross bridge cycling. So the detailed version is not possible to discuss here, but at least you remember these 4 steps, that in which stage which molecule is attached on the myosin head and which molecule is required to be released or attached for different stages. ये चारों स्टेज का नाम याद रखो, important है. Okay, so ये हो गया हमारा muscle contraction, single liner, everything. Now I told you that certain difficult MCQs, but I believe all of you have practiced those MCQs, so there should not be much difficulty in answering this MCQ. So first MCQ, erythropoietin is secreted by which of the following? Okay, so obviously we know that kidney is the main site of erythropoietin production. 80 to 90% is kidney, and in kidney, peritubular, capillary, epithelium cells, okay, along with the NORN, no cell, okay, ये दोनों. But along with that, liver also produces erythropoietin, perivenous hepatocyte, okay. These are the 2 main, and this is also given in books, but recently it has been discovered that erythropoietin mRNA, means erythropoietin synthesis, can also be possible in other organ. Like for example, little bit of erythropoietin can also be seen in lungs, in brain, in bones, and in spleen. EPO mRNA has also been detected in this region. Okay, so etocell, that is the perivenous hepatocyte का ही और एक नाम है ना, etocell. Okay, so please remember, yes, so lungs can also produce a little bit of erythropoietin, most probably because erythropoietin mRNA is also detected in those sites, but these are the very rare. The main site of erythropoietin production is kidney, but apart from kidney, 10%, around 10% erythropoietin is also produced by liver. Okay, but suppose these options are also given, that erythropoietin प्रोडक्शन कैन ऑल्सो बी सीन फ्रॉम, उसमें मान लो ये लंग आ गया, ब्रेन आ गया, देन इसको देखना होगा कि ये बेस्ट पॉसिबल वे में आपका आंसर सूट कर रहा है कि नहीं कर रहा है. बट इफ़ यू लुक एट हियर, नीदर दिस ब्रेन, लंग, स्प्लीन कुछ भी नहीं दिया है, मसल पे तो नहीं होता है बिल्कुल, हार्ट पे भी नहीं होता है, बट बाकी दोनों में आंसर होगा. सो ए एंड बी बोथ, सो आंसर ऑफ दिस क्वेश्चन इज ए बी. गेटिंग माई पॉइंट? सो लिटिल ओविडक्ट मेरे को नहीं मिला, ओविडक्ट का मतलब आई हैव ऑल्सो सर्च इन लिटरेचर, बट this is not given in everywhere. There are certain recent article where these organ names has also been given, that erythropoietin, little bit of erythropoietin mRNA has also been seen in these cells, brain, okay, liver, spleen, these are the things. liver में तो होता है ये, brain, bone और spleen, ये सब जगह में देके रखा है. ठीक है, सो एडिशनली याद करो, पॉसिबल होगा तो बिकॉज क्वेश्चन पे दे सकते हैं. ओके, नाउ लुक एट दिस क्वेश्चन, दिस आर द रिपीट क्वेश्चन. एक साल में एक पहला क्वेश्चन आया था, दूसरे साल में दूसरा क्वेश्चन आ गया था, बट ऑप्शंस में थोड़ा बहुत रिकॉलिंग प्रॉब्लम हो सकता है. बट सपोज दिस इज द क्वेश्चन, दिस आर द 4 ऑप्शन, पहला क्वेश्चन का आंसर बताओ, सेकंड क्वेश्चन का आंसर बताओ. सो दिस इज़ वेरी सिंपल क्वेश्चन, बट क्या होता है एग्जाम में थोड़ा सा आपका दिमाग को ठंडा रखना होगा. ओके, सो इंक्रीज इन रेनल ब्लड फ्लो, सो इंक्रीज रेनल ब्लड फ्लो होगा तो क्या विल बी, देयर विल बी इंक्रीज इन ग्लोमेरुलर हाइड्रोस्टैटिक प्रेशर, दैट इज अ PPC, hydrostatic pressure of the capillary will be increased. That means second one is also given in the option. So ये दोनों में GFR increased हो जाएगा. Decrease Bowman's capsule oncotic pressure. So Bowman's capsule oncotic pressure is generally near equal to 0. उसका decrease क्या होगा? So this is basically a false statement because Bowman's capsule oncotic pressure is near equal to 0. But if you look at the other option, decrease glomerular oncotic pressure, it will also increase the GFR. It will also increase the GFR. So ये दोनों में तो GFR increase होता ही होता है. Okay, GFR increase होगा ही होगा. Okay, last में भी होगा. So theoretically, answer of this question will be this. If this is the exact option given, then your answer is going to be C, because all other options are not correct. Right? Right? Because decrease glomerular oncotic pressure तो increase हो जाएगा ना GFR. Because oncotic pressure is a kind of retaining force. So if there is decrease in glomerular oncotic pressure, so GFR will be more. And second question, increase filtration coefficient. So here you try to remember that the GFR is equal to KF multiplied by net filtration pressure. Net filtration pressure. So this KF is known as the filtration coefficient. So obvious thing is that if there is increase in KF, तो obviously आपका GFR is also going to be increased. Okay, so this first one is not my answer. Okay, GFR increase हो जाएगा. Decrease oncotic pressure of the glomerulus. Again, I just explained that decrease oncotic pressure is not possible. Increase in hydrostatic pressure of the glomerulus, so it will also increase the GFR. So only option that is correct here, increase in the hydrostatic pressure of the Bowman's capsule. Like for example, urinary obstruction, bladder obstruction, okay, obstruction in the ureter. So all of these things will causes increase in hydrostatic pressure, and that will decrease the GFR. So this way, simple question. बस थोड़ा सा, because in exam you know our brain sometimes stops working. Okay, generally there is a कहावत हम लोग बोला जाता है कि our brain is an amazing organ, right? Okay, it's started working from the fetal life, and it's going on working for throughout the day, throughout your lifespan. Okay, so our brain is working continuously, always, without any resting. But our brain stops working in two conditions: when you fall in love and when you enter in the exam hall. So be careful, दोनों में ही ब्रेन काम करना बंद कर देते हैं थोड़ी देर के लिए. सो आपको अच्छे से सोच के आंसर करना होगा. ओके, सो दैट इज द सिनेरियो यू हैव टू रिमेंबर. ओके, अमेजिंग ऑर्गन ऑलवेज वर्किंग, बट ये दोनों कंडीशन में प्रॉब्लम हो जाती है. सो इसलिए ध्यान रखो. ओके, चलो, sympathetic activation होगा तो भालो, it will be good for the arousal, so your brain will be more active. Okay, so it will बोलते हैं ना कि थोड़ा बहुत टेंशन हो रहा है, if there is a little bit of tension before your exam, that is good. Okay, because more sympathetic activation means it is going to activate your arousal system, your brain will work more. Okay, बिल्कुल ही आप बिंदास बैठे हो, जो होगा होगा एग्जाम में, that should not be the attitude. थोड़ा सा टेंशन होना जरूरी है एग्जाम से पहले. ओके, राइट, चलो. Now next question, which factor contribute to the latent period in a single muscle twitch? Single muscle twitch. So single muscle twitch tetanizing frequency calculation में भी दिया जाता है. So in tetanizing frequency calculation you have also seen single muscle twitch. So what is single muscle twitch? Okay, if you record the contraction and relaxation of the muscle. So suppose this is the neuron is going to level of the muscle. This is my skeletal muscle. Okay, so this is my muscle. Okay, and this is my nerve. This is my nerve. If I give a stimulation to this nerve, the muscle is going to contract. Okay, and whenever the muscle is contracting, there will be relaxation after the contraction. So suppose this is the point of stimulation. Suppose I am recording this contraction and relaxation with a graphical representation. So suppose this is the point of stimulation. So after the point of stimulation, there will be a time gap, and after that time gap, the contraction of the muscle will start, and after the contraction is over, the relaxation is going to start. So this is the relaxation, this is the contraction, and the time gap which is between the application of the stimulus and between the onset of the contraction, time gap between the application of the stimulus and the onset of contraction, this is known as the latent period or LP. Okay, so latent period क्यों लगता है? So look at this diagram. So I am giving stimulation here. What will happen? First of all, the action potential will travel down through this nerve. Then the action potential will cross this neuromuscular junction. Then the action potential will release the calcium from sarcoplasmic reticulum. And then after the release of calcium from sarcoplasmic reticulum, the actin myosin cross bridge is going to happen, and then the contraction is going to happen. So all these things is there in the latent period. So that's why latent period means excitation contraction coupling. Obviously excitation contraction coupling is required for the release of calcium, is required for the release of calcium contraction. Okay, so obviously excitation contraction coupling is required. Second, the time interval from the point of stimulus to the onset of contraction, this is the definition of the latent period. Third one, neuromuscular junction transmission, obviously this will also require time. But fourth one जो देके रखा है, transfer of calcium back into the sarcoplasmic reticulum, this is required for the relaxation of the skeletal muscle. This is not part of the latent period. So that's why answer will be 1, 2 and 3. Option A is the correct answer. ठीक है, ये ध्यान रखो. Okay, next one, which of the following are seen in decompression sickness? So decompression sickness, It was a question in the previous year also. But simple ऑप्शन था, बिकॉज इन डिकम्प्रेशन सिकनेस 3 चीज़ हमारा बुक में देते रखता है. देयर विल बी बेंड्स, जॉइंट का फ्लेक्शन हो जाएगा, बेंड्स होगा. देयर विल बी choking and there will be dizziness. Means main symptoms of the decompression sickness. Decompression sickness is also known as the Caisson's disease. Okay, Caisson's disease or dysbarisms or diverse palsy, बहुत नाम पे जाना जाता है. इसमें जो मेन सिम्टम्स होता है, व्हाट इज द मेन सिम्टम्स? मेन सिम्टम्स इज द बेंडिंग ऑफ द जॉइंट्स. दैट्स व्हाई दिस इज नोन एज द डिजीज ऑफ द बेंड्स. There will be choking of the lung capillaries, so chokes, disease of the chokes, right? And there will be also CNS symptoms because of the blocking of the capillary in the CNS. The dizziness symptoms will be there. But now if you look at this option, here nothing common symptoms has been given, but I can easily predict that decompression sickness, when it is going to happen, when the person is working underwater for long duration. So high pressure may causes this hearing loss, high pressure may causes this visual loss. Okay, nitrogen bubble is blocking the capillary, so coagulopathy can also happen because nitrogen bubble is blocking the small capillary, so coagulopathy can also happen. But hemodilution is not going to happen because you know nitrogen bubble damages the capillary's endothelium, and whenever the capillary endotheliums are damaged, more fluid will go out of the capillary. So if the fluid is going out of the capillary, there will be hemoconcentration rather than hemodilution. So that's why in case of decompression sickness, because the nitrogen bubble is blocking the capillary, it can also damage the endothelium cells, and damaging of the endothelium cell means there will be increase in capillary permeability, which will leads to more loss of water from the capillary. So there will be hemoconcentration inside the capillary. Hemodilution is not a feature of decompression sickness. So obvious answer is option number A, right? So this is thing you have to remember. Now next one, which of the following is not a mechanism of action of antidiuretic hormone? Little difficult question, okay, but one question, one answer is very easy, because if you look at the all options, when the first time this question is coming, it will be difficult, I am telling you, but now you know the answer, so that's why it is easy for you. Okay, so if I look at all of the option, even the first time when I looked at this question, मेरे को भी exact answer पता नहीं था, but I was 100% sure that NaCl का reabsorption में ADH का कोई role नहीं है. Okay, so A, option number C is the answer, which is not a mechanism of action of the ADH. But two mechanisms are very sure. Increase water permeability in the collecting duct. This is one of the best important mechanism of the ADH, because ADH stimulate the V2 receptor, okay, and that V2 receptor stimulation means what will happen? The aquaporin 2 channel will be stimulated and it will causes increased water absorption from the collecting duct. It is also a separate MCQ. Second thing, ADH not only increases water from the collecting duct, it also causes increase in urea reabsorption from the collecting duct, This is also a very prominent mechanism of the ADH, and you better remember this transporter. UTA1 is the name of the transporter, which is mainly stimulated by ADH, although UTA3 transporter is also stimulated by ADH. So they can also give you a question that ADH increases urea reabsorption by stimulating which of the following transporter? Urea transporter UTA1, okay, that is present at the luminal membrane of collecting duct epithelium cell. So UTA1 is the main transporter which is stimulated by ADH, although it can also stimulated UTA3 transporter, UTA1 and A3, not the UTA2, राइट. सो ये दोनों ट्रांसपोर्टर का नाम याद रखो. सो ये दोनों तो सिंपल हो जाएगा. बट जो सेकंड ऑप्शन में देख रखा है ना, इंक्रीज इन एब्जॉर्प्शन ऑफ यूरिया इन द असेंडिंग लिम्ब ऑफ लूप ऑफ हेनले. असेंडिंग लिम्ब ऑफ लूप ऑफ हेनले एक ऐसे जगह है जहाँ पे यूरिया का सिक्रेशन भी होता है, एब्जॉर्प्शन भी होता है, बहुत ही माइन्यूट अमाउंट. इफ यू लुक एट द रेगुलर बुक, no regular book has mentioned that ascending thick segment of the loop of Henle there is urea reabsorption. But if you look at the postgraduate physiology book boron, there it has been given that very little amount of urea is also reabsorbed from the ascending limb of the thick loop of Henle, okay, thick ascending limb of the loop of Henle, and this urea reabsorption is passively done by ADH, not actively. Okay, transporter is not stimulated, but this is passively increased by ADH. So, this is also true, but sodium chloride reabsorption, ADH has no action. So, ADH has two main action on water reabsorption and for urea reabsorption. Okay. Why not option B? I just explain. I believe you now I explain this. Okay. So, option B is also partially true for ADH because ADH passively helps in the reabsorption of urea from the thick ascending limb of the loop of Henle. Okay. But ADH has no action on NaCl reabsorption from ascending limb of loop of Henle. ठीक है Dr. Sanvi and all. Sodium chloride is reabsorbed by which transporter? सोच के देखो ना, which transporter? NKCC. NKCC is the transporter. NKCC में ADH का कोई रोल नहीं है. ओके. सो NKCC ट्रांसपोर्टर में उसका रोल नहीं है. ठीक है. चलो अब देखो, surface tension of the fluid lining the alveoli increases during. Okay. So again, this is a kind of question. Some of the guidebook has given wrong answer. Surface tension of the fluid lining the alveoli increases during. बताओ तो क्या आंसर? Okay. Yes, during inspiration. Okay. So now I believe you have already done the answer of this question, and if I ask you why, so look at this explanation here. So when you are inspiring, what will happen to the size of the alveoli? I am taking in. So alveoli are expanded. Look at here, inspiration, inspiration. So the alveolar size is expanded. This is the alveoli, it is expanded. Whenever the alveoli are expanded, what is happening to this surfactant molecule? Surfactant molecule is spreading out. So whenever the surfactant molecule is spreading out, okay, what will happen to the density of the surfactant molecule? Density decreases. If the density of the surfactant molecule decreases, what will happen to surface tension? Surface tension increases. But whenever the person is doing expiration, expiration means alveoli का size छोटा हो गया. Expiration means there is decrease in size of the alveoli. A decrease in size of the alveoli means the surfactant molecule are getting crowded at the inner lining membrane of the alveoli. So there is increase in density of the surfactant molecule. Increased density of surfactant molecule means more the surfactant molecule means what will happen to the surface tension? The surface tension is going to be reduced. Okay. So surface tension is going to be reduced. So that's why during exhalation, so this graph is taken from a research article. During inspiration, the surface tension is rising, and during exhalation, the surface tension is decreasing. The surface tension is decreasing. Getting my point? I believe now you remember this thing. Okay. Okay. So this is the actual explanation. Laplace law is applied at the level of alveoli, but better explain in this language, that will be better. Okay. So this is the reason for the answer. Now, I told you at the beginning that there are certain MCQs which are very rare or which are very I mean weird type of questions, and we should not spend much of our time on this kind of MCQs. Like here, this carrageenan, okay, only used in experimental model, in experimental lab, especially the pain producing lab, pain lab जो होता है न्यूरोफिजियोलॉजी का pain lab, right? So obviously this is not given in any of the regular book, including the postgraduate physiology book also. Only if you search literature, then you will get enough of the carrageenan mediated experiments. So इसमें क्या कहा जाता है? So this is basically a seaweeds. Yes. So this is basically a seaweed. Okay. So ये seaweed क्या करता है कि जो in animal experiment, it is injected in the mouse pad. Okay. So mouse का जो foot pad होता है, sorry, foot pad of the mouse. So it is injected in the particular body part like the foot pad of the mouse. So whenever you are injecting it, it will causes inflammatory reaction. Okay. So what is going to causes? It will causes non-immune mediated, it will causes non-immune mediated inflammation. So this is the basis of this question, that what is the utility, okay, or what kind of pain is produced by this carrageenan. So your answer will be inflammatory pain. So C is the answer of this question. Getting my point? So these are the all difficult MCQs they has been asked in the last 3 years we discussed here. So also go through this MCQ quickly. Okay. Now we are actually coming to the mathematical calculation, mathematical problem, very simple problem, but just you have to remember the formula, and I believe you will be able to do it in the exam also. Okay. So the first mathematical formula that you have to remember is the alveolar ventilation. Okay. So from this data which is given here, you have to calculate what is the alveolar ventilation. So एक होता है pulmonary ventilation, pulmonary ventilation. So pulmonary ventilation formula simple tidal volume जो होगा, so simply you multiply the tidal volume multiplied by respiratory rate. But whenever alveolar ventilation is given in the question, so alveolar ventilation means all the tidal volume is not entering in the alveolar zone because there is a presence of a dead space. So alveolar ventilation will be equal to TV tidal volume minus dead space volume multiplied by respiratory rate. So with this formula, if you calculate here, all are in the same unit, 500 ml minus 150 ml multiplied by 20. So obviously answer हो जाएगा इसका 7000 ml per minute. So this is the alveolar ventilation. Okay, 7 liter per minute. Now I believe I am going pretty fast. Okay, so you can easily catch up later on. I mean, you can download the PDF later on also, and you can just scroll through the PDF because very simple mathematical equations are here. Calculate the oxygen carrying capacity. So I believe everybody will be able to do it. Very simple question. So we know that whenever the hemoglobin is saturated normally, okay, the 1 gram of hemoglobin can carry 1.34 ml of oxygen. Okay, ml of oxygen. So this is the basis. But sometimes we have to remember that 1 gram of pure hemoglobin can carry 1.39 ml of oxygen. Because normally our body में, हमारा blood में, the hemoglobin which is present in our blood, that is not pure. There will be little impure hemoglobin in the form of carboxyhemoglobin, methemoglobin. So that's why, assuming that the hemoglobin is impure in our blood, we assume that 1 gram of hemoglobin will carry 1.34 ml oxygen. So obviously the 14 gram hemoglobin 14 multiplied by 1.34. So this will be calculation कितना होगा 18.76 होगा. So better is the 18 will be the answer. Here you multiply the option that was given in the actual question. There was a very big gap between two number. Okay, very big gap between two number. Even you calculate 1.39, it will be near equal to 19 or 20 के आसपास. But in the option, I think 18 was there, 21, 22 ऐसे कुछ answer था. So obviously it will be 18 is the closest answer in the options. Okay, so even if you are suppose that if you are calculating 1.39, you are getting a number which is also similar. But again go for this 1.34 only, because if the question is saying nothing of pure hemoglobin, you go for the normal actual scenario, not the purest form of hemoglobin, because question here is straight cut saying oxygen carrying capacity of hemoglobin without saying pure odd. So pure odd नहीं है means 1.34 ml को यूज करेंगे. Okay, चलो no break क्या है और 1 घंटा लगेगा. Tidal volume of a person is this. Okay, what I have to calculate? I have to calculate the compliance. So whenever you are looking at the question, you have to calculate compliance. So we all know compliance formula is delta V upon delta P, means change in volume, lung volume per unit change in lung pressure, intraalveolar pressure or interpleural pressure or whatever. Okay, so change in lung volume. So whenever you are taking inspiration, there is an expansion of the lung, and that is changing 500 ml of lung volume inside the lung. So this is delta V in these cases. Interpleural pressure before the inspiration -4, after the inspiration -9. So both are in the minus. So obviously the delta P change of pressure is only 5 centimeter of water. Okay, so obvious thing is that if I put into this equation, compliance is equal to 500 ml is the volume change upon 5 centimeter of water is the pressure change. So obviously this will be 100 ml per centimeter of water. Okay, so this is known as the compliance of this person. 100 ml means if you change 1 centimeter of interpleural pressure, lung will expand 100 ml. Okay, that is the meaning of the compliance in this question. Okay. Now the filtration pressure calculation. So the filtration pressure, whether you are calculating at the level of the capillary or you are calculating at the level of glomerulus. So glomerulus means this is also capillary. So in anywhere, whether it is tissue capillary or the glomerular capillary. So here this is the data from the tissue, because here it is mentioned tissue hydrostatic pressure. But suppose rather than tissue, glomerular capillary pressure you have to calculate, then also the same formula will be used, and all of you know what is the formula. Formula is the Starling law formula, Starling law formula. Okay. So, we know the formula, very simple formula. So, if this is the capillary, okay, so this is the capillary, blood is flowing in this direction. So, when the blood is flowing in the capillary, because of the water content of the capillary blood, there will be an hydrostatic pressure. So, this hydrostatic pressure of the capillary will try to push the fluid out of the capillary, and suppose this is the tissue space. So, inside the tissue there will be little amount of water. So, suppose this is the PT, hydrostatic pressure of the tissue, it will try to push the fluid inside the capillary once again. Okay. Then if you look at the oncotic pressure of the capillary, so oncotic pressure of the capillary will try to hold the water inside the capillary. Okay. And oncotic pressure of the tissue oncotic pressure pi t will try to drag the water from the capillary. So, if I have to calculate a net pressure which will be exerted from this capillary towards this tissue space, so I have to apply the Starling formula. What is that Starling formula? So, the net pressure will be equal to Pc minus Pt, right, plus pi t is helping pi t minus pi c. This will be the formula. So, now if I put into this equation, so what will be the net pressure? Calculate karo sab log. Net pressure will be Pc, capillary hydrostatic pressure is given 30 minus 2, okay, plus 2 minus 25, okay. So, this will be 5 millimeter of mercury, 5 millimeter of mercury towards the tissue. So, this is the formula you have to remember, simple formula, but exam में कभी-कभी गलती होता है, so try to remember. Okay. Now, calculate the interstitial fluid volume from the data. Okay, interstitial fluid volume you have to calculate. Okay, remember. But look at here, what you have injected? You have injected inulin. Inulin is used for measuring which volume of water? Inulin is used to measure which volume? ECF, extracellular fluid volume. Okay. And here the question is asking about the interstitial fluid. So, we all know that extracellular fluid is equal to the, okay, plasma volume, matlab blood volume, sorry, plasma plus your interstitial fluid volume, यही ना? So, यहाँ पे देखो पहले आपको क्या करना होगा, because it has been given inulin. Inulin given means you have to first calculate what is the ECF volume. पहले ECF volume calculate करके बताओ. So, the formula that will be used here is the volume of distribution formula. Volume of distribution formula, right, which is also known as the dye dilution formula. So, volume V is equal to Q minus E upon C. So, Q is given here, amount of inulin that is injected 120 milligram, calculate किया है, yes 120 milligram. उसके बाद after 1 hour inulin is excreted, that is 5 milligram. So, 5 milligram is excreted and then the unit is 0.01. So, ये कितना हो जाएगा? This will be equal to 11500. मैंने कैलकुलेट करके पहले रख दिया, इतना ml होगा, 11.5 लीटर. And now if I have to calculate the interstitial fluid volume, so ये कितना हो जाएगा? Very good. So, 11500 minus 3500. So, that will be the volume of the interstitial fluid in this question. Okay, because you are calculating this 1150 volume, this is what? This is ECF. Why ECF? Because you have injected inulin. Inulin is the best measure for the extracellular fluid volume. Got it? Okay, very good. All of you are doing great. Very good. अच्छा है preparation. Good, good. Now calculate the cardiac output. Okay, from this person. So cardiac output is mostly the calculation that has been given earlier also. That is a fixed principles. That is a fixed principles, and all of you know this fixed principle. Okay, but for the INI-CET, you also remember that there is a dye dilution method which can also be used for the calculation of the cardiac output, or thermodilution method, which is based on a principle which is known as the Stewart-Hamilton principles. Hamilton principles. Stewart-Hamilton, W-A-R-T. Stewart-Hamilton principle is for dye dilution or thermodilution method of cardiac output measurement. But here the question is about the fixed principles. So, fixed principle is saying cardiac output is equal to oxygen consumption by the person upon your artery venous oxygen difference, artery minus venous oxygen. So, oxygen consumption upon artery venous oxygen difference. Now, if you look at the oxygen consumption here, this is 240 ml, very good. But if you look at the arterial blood oxygen content, this is given 20 ml percentage. 20 ml percentage means 20 ml per 100 ml of blood. 100 ml. So, इसको per ml में लेके आ जाओ, then your answer will be easier to calculate. So, it will be 0.2 ml per ml of blood, and it will be 0.15 ml per ml of blood. Okay. So, now I will put it here minus 0.15 ml. Okay. So, now it will be finally 4800 करके देख लेना, it will be the cardiac output 4800 already you have calculated, very good. Okay. ठीक है. So, just remember this simple formula, and in the exam look at the unit. The unit should be in same. If it is 240 ml of oxygen consumption, then all of this unit has to be converted into ml per ml, ml per ml, ml per deciliter you cannot. So, that is why I have converted this unit into ml per ml. So, this is the oxygen content of arterial blood, venous blood, and then you put into the equation. Okay. Next question. Okay. So, this is a pressure volume curve. I believe all of you know the pressure volume curve in the cardiovascular system. So, this is the filling phase of the pressure volume curve, then this is the isometric contraction. After the isometric contraction, this is the ejection phase, okay, and this is the isovolumic relaxation phase. Okay. So, this is the PV loop. So, in normal PV loop, after the end of the ejection means this point, this is volume which is known as the this is known as the end systolic volume. This is end systolic volume, and the volume which is present at this point, this is the end diastolic volume. This is the end diastolic volume, right. So, obvious thing is that stroke volume will be equal to end diastolic volume minus end systolic volume. So, if you look at this number here, end diastolic volume is almost 150 ml here, and end systolic volume kitna, this is 50. So, this is 75. So, basically this is 75 basically. So, 150 minus 75. So, this is 75 is the stroke volume. We know the ejection fraction formula. So, ejection fraction is equal to stroke volume upon end diastolic volume. So, stroke volume is 75, end diastolic volume is 150. इसका percentage लेना होगा. So, this will be around 50%. Around नहीं, this is exactly 50%. Okay. So, this is the ejection fraction 50%. Okay. Very good. Right. S1, S2, I believe all of you know that thing. Okay. So, S1 is here at point number S1 is here, and S2 is here, S3. Okay. So, this is S1 point, this is S3, S2 point, right. Okay. Now, next question, resistance flow calculation. So, this is basically Poiseuille's Hagen formula. Okay. So, Poiseuille's Hagen formula is saying that resistance is equal to L upon R to the power 4. So, this is the formula I have to remember here, that resistance depends on the length directly proportional. So, resistance of a blood vessel directly proportional to the length, and it is inversely proportionate to the radius or diameter, whatever you say, radius to the power 4, right. So, based on this, if I arrange this, that vessel A upon vessel B, vessel A here and blood vessel B. So, blood vessel A का जो length, so if I calculate the resistance of the blood vessel A, so length is 2L and radius or the diameter 2D, so 2D to the power 4, okay. And for blood vessel B, length is the L1 and diameter is D, so to the power 4. So, this is the equation A upon B. So, if I simplify this, so this is 2L upon 2 multiplied by 2 multiplied by 2 multiplied by, so this is 16D multiplied by D upon L. So, आप जानते हो क्या करना होगा, L कट जाएगा, D कट जाएगा, so 2 upon 16, so this will be 1 upon 8 times. So, the resistance of A is 1 upon 8 times than that of the B, okay. And if I ask you what will happen to the flow, so the flow rate is inverse of the resistance. So, flow of A will be 8 times more, 8 times more flow, 8 times more flow in blood vessel A in comparison to B, okay. So, 8 times more flow will be there because the flow is reverse of the resistance, inverse of the resistance, okay. So, ये हो गया हमारा आंसर. Now clearance calculation, again this will be very simple, just you have to calculate this thing into simplify formula, like this is 15 milligram per dl. I told you first of all you convert this dl, deciliter, deciliter means 100, 100 means this will be 1.5 milligram per ml, right, and here it will be 7.50 milligram per ml, and here it is no change is required here because it is ml per minute. Okay. So now you put into the formula. So the clearance is UV upon P. So U is the urine concentration of the substance, that is 7.5, multiplied by V is the urine flow 1 ml, and P is the concentration in the plasma. So if you just simplify, it will be how much I have calculated already, 50 ml per minute, 50 ml per minute. Okay, ये हो जाएगा आपका आंसर. So clearance, urea clearance from this data, it will be 50 ml per minute. Okay, ठीक है ना, कैलकुलेशन ठीक है ना. सो यूनिट सेम कर लेना होगा, बिकॉज यहाँ पे देखो ना आपको कौन सा यूनिट पे देके रखा है, यहाँ पे वॉल्यूम देके रखा है 1 ml पर मिनट. सो इसको डीएल पे रखोगे तो मुश्किल हो जाएगा, इसको डीएल पे रखोगे तो आपको ध्यान देना होगा, अदरवाइज इसको सिंपल एमएल में कन्वर्ट कर लो. डीएल इज इक्वल टू डेसीलीटर 100 ml, सो 100 से डिवाइड कर दो, दैट्स ऑल. ओके, नेक्स्ट क्वेश्चन. I believe this question has been there in the INI-CET for multiple times. So all of you know the titannizing frequency calculation. जब भी आता है आँख बंद करके कर दे तो ये image based भी, this question can be given as an image based question also, simple question also. So titannizing frequency means 1 upon contraction period duration. 1 means 1 second upon contraction period duration. 1 second means that is equal to 1000 millisecond. 1000 millisecond upon contraction period duration in millisecond. So in this question it is given the latent period is 10, it is not required, contraction 40 and relaxation 50. So only I required this 40 millisecond. So whenever I am dividing this 1000 millisecond upon 40 millisecond, so this will be 25 hertz. Okay, 25 hertz. Yes, 1 upon 40 means 1 is the second, 1 means 1000 millisecond upon 40, so 25 hertz is the answer. Okay, chalo. Next, calculation of the gain of the control system. Again this question एक बार आया है already. So suppose my blood pressure is normal level, this is, and in the question it is saying that there is reduction of the blood pressure 10 millimeter of mercury. So 10 millimeter reduction हो गया. After the reduction of the 10 millimeter of the blood pressure, okay, there is gain, he regained 8 millimeter of mercury blood pressure. So 8 millimeter again it has increased because of the correction. Okay, so after 8 millimeter correction still there is an error. So there is an error, how much blood pressure is still not normalized again. So this is 2 millimeter of mercury. So this 8 millimeter is the correction. So this is the correction and error is 2 millimeter of mercury. So obviously we all know that gain is equal to the correction upon error. So C upon E means 8 upon 2. So this is 4, but it is negative gain because the changes of the blood pressure is happening in the downward direction, correction is happening in the upward direction. So that's why this is negative. -4 will be the actual answer, but if the options are not the -4, so 4 will be the answer. Okay, otherwise if -4 plus 4 both are given, this is a negative gain. ठीक है, okay. Equilibrium potential calculation, again a very pet question, but why I have kept it here, because just don't forget the formula of the equilibrium potential calculation. So equilibrium potential calculation formula, the formula is RTZF upon natural logarithm of concentration of the ion outside the cell membrane, concentration of the ion inside the cell membrane. But I told you, you don't have to remember this formula. There is a simplification of all of this thing, because you know these R, T, F, they are the constant. So basically this will be plus 61 millivolt upon Z log natural logarithm we have been converted into log base 10. Okay, concentration of the ion which is present in the outside, concentration of the ion which is present in the inside. This is the formula. Please try to remember this formula. Okay. Now in this question, so equilibrium potential EQ is equal to plus 61. In place of Z I am going to put plus 1 because potassium is the ion. So potassium is plus 1 charge. So that's why I put plus 1. Then I will put log. So log base 10. Concentration of the potassium, it has been given here. Intracellular concentration is 10, extracellular 100. So 100 अपॉन 10 देख रखा है. This is just opposite. Normal cell में उल्टा होता है ना. In normal cell, more potassium is inside the cell, but this is a model cell. So that's why the word is used model cell, theoretical cell, not the actual cell. Okay. So now it will be plus 61 multiplied by log 10 base 10. Log 10 with base 10. So log 10 base 10 का जो value होता है, we know that is 1. So this is basically plus 61 millivolt is the actual answer, not the minus 1, because please remember, normally potassium has an equilibrium potential of minus 90. Normally potassium equilibrium potential is minus, negative potential equilibrium potential for potassium. But here they have changes the concentration of the potassium between ECF and ICF. Normally the ICF potassium is higher. If the ICF potassium is higher, then the potassium equilibrium potential will be negative. Otherwise, according to this formula, here the equilibrium potential of potassium will be positive. Okay, that is the only basic thing you have to remember here. Now we are coming to the important images. Okay, important images. Some of the things has been discussed already. Now apart from those, some images are very important, like for example this action potential and ionic permeability. कितनी बार ये क्वेश्चन आया है, मल्टीपल टाइम्स दिस क्वेश्चन हैज बीन आस्क्ड इन द एग्जाम. ओके, so you should not make any mistake in the action potential diagram. So this is the action potential from the nerve and skeletal muscle. Okay, so the first one, this A is the action potential. So this A, this is the actual action potential diagram. Action potential, how I am identifying? Because there is a negative part of this curve. One part of this curve is going below the RMP. So this is basically my action potential. Action potential. Now during this action potential, we all know that this upward phase is the depolarization phase and this downward phase is the repolarization phase. Repolarization phase, that's okay. But during this action potential, sodium permeability and potassium permeability, how it changes. So this green color curve, this is the sodium permeability. So sodium permeability increases to a very high level. It reaches a peak at point A, okay, here the point B, and then the permeability is suddenly reducing to 0. What is the meaning? Meaning sodium channel which is present in the neuronal cell membrane, they open very rapidly and they also inactivated very rapidly. That's why if you look at the action potential, along with the action potential depolarization, sodium permeability is also rising and then suddenly sodium permeability is decreasing. Why the sodium permeability is decreasing suddenly? Because of the closure of the channel. Actually not closure, that is the inactivation of the channel, but whatever. This is the opening of the channel, this is the opening of the channel, sudden opening and sudden inactivation. This is the typical property of the voltage gated sodium channel. So this curve B, the curve B is what? The curve B is the sodium permeability. Sodium permeability during action potential, or how the sodium channel is behaving. So the sodium channel is very fast in nature. So that's why they are opening and closing very fast. Now the curve C kya hai? What is curve C? If you look at the curve C, what it is showing, the permeability is slowly rising and then it is slowly decreasing and then it's coming to 0. Means the C curve is depicting certain channels which are slow to open, slow to close, and this is typical of potassium channels. So this is the potassium permeability curve. This is the potassium permeability curve, right? It's a very slow channel. Now there is a very frequent question that if I ask you that at top of the action potential or at point number A, what are the channel open at point A? Sodium channel open, potassium channel open, both are open, only sodium channel is open. Suppose this is the type of question they have given. Sodium is open, potassium is open, both are open, none of them are open. ऐसे type का is our option. So what will be your answer? Okay, at point A, peak of the action potential. So what I am going to do, I am going to drop one perpendicular from the point from where the question is given. So suppose this is my ruler. From this ruler, I am going to drop one perpendicular from this point. Okay, so I am dropping on perpendicular. if I drop on perpendicular, I am going to check that this perpendicular is cutting which curve? Only sodium permeability curve, only potassium permeability curve, or it is cutting both the curve? If it is cutting both the curve, that means both channels are permeable. If it is cutting only one curve, that means only one channel is permeable, other one is not. So now from the curve you can easily see that this perpendicular which I have just made, it is cutting the sodium permeability curve also, potassium permeability curve also. So during the peak of the action potential or during the depolarization phase of the action potential, what are the channels open in the neuronal membrane? Both sodium channel, both potassium channel. But if I ask you which channel permeability is more or which channel numbers are more, obviously the sodium channel number or permeability is very higher than that of the potassium channel permeability, and that's why you can easily understand that suppose this is the neuronal membrane, this is the neuronal membrane, sodium channel is also open, so sodium is entering in the cell, potassium channel is also open, so potassium is going out of the cell. So you may be thinking that, sir, if both the channels are open, so both are positive charge, so both will neutralize one another, how the membrane voltage is rising upward in the positive direction? Answer is sodium channel number is very huge than potassium channel number opening during the phase of depolarization. That's why the membrane voltage is rising in the upward direction. But if I ask you that during this after hyperpolarization phase, this phase is known as the after hyperpolarization phase. If my question is that during after hyperpolarization phase, which channels are open? So what I am going to do, I am going to drop on perpendicular from this after hyperpolarization phase. Now whenever I am dropping an after hyperpolarization phase, look at here what it is cutting. So it is cutting only this blue color curve here, only this blue color curve, although it is cutting the green color curve, but that green color curve is at 0 level, that curve is at 0 level, that 0 level means the sodium permeability is 0, that means this is only potassium permeable, only potassium permeable. Getting my point? So this way you have to answer in exam. Okay, it is very tricky because sometimes whenever the question is at repolarization, if I ask you during this part at point number this, which channel are open? Both sodium potassium. आप बोलोगे सर ये तो repolarization ना, आप immediately मारोगे potassium channel open, sodium channel close, but देखो, look at here what is happening during repolarization also, suppose this is the point where I have to answer that whether the sodium channel is open, both channel are open, suppose this is the point. Okay, what you are finding out here also both the channels are open. देखो ना कहाँ पे काट रहा है, this is cutting here, this is cutting here, green color का आपको काट कर रहा है, यहाँ पे blue color का आपको काट कर रहा है. So now if I have to answer that during the repolarization phase also here both the channels are open, but which channel number are more? Which channel number are more here? Potassium channel number are more, and that's why cell is losing more positive charge in the form of potassium. That's why repolarization is happening. Getting my point? Although both are open here, both are open, sodium channels are still open, but number कम हो गया ना, potassium channel number ज़्यादा हो गया, इसीलिए repolarization हो रहा है. Okay, but during depolarization, sodium channel number are more than potassium channel number, so that's why depolarization. Getting my point? So this concept should be learned very carefully, otherwise the simple mistake will be done in the exam. ओके इसके बेसिस पे क्वेश्चन सेम इमेज आता है, सेम क्वेश्चन आता है, बार बार घुमा फिरा कर डिफरेंट ऑप्शन दिया जाता है एंड यू मेक मिस्टेक. Okay, so you should answer in this way. Okay, now next question or next image basically. So this is a very simple image, all of you know. So if this is a kind of electron microscopic diagram, if this is given in the question, first of all you try to identify the Z line. First of all you try to identify the Z line. How I am going to identify the Z line? Okay, so within this white zone, white zone is the I band. In the middle of the white zone, the line which is present, that is the Z line. So this is Z line, this is another Z line, and in between these two Z line, the length of this part, this is nothing but the sarcomere length. Okay, so this is nothing but sarcomere length. Okay, sarcomere length. So in this sarcomere, the dark portion that you are getting, this dark portion is the A band. So this whole part is the A band, and within this whole part of the A band you are getting a lighter zone. So this is one of the lighter zone within the A band. This is known as the H band. This is known as the H band, and at the center of this H band you are getting one line, that is the M line. Okay. So, this is also part of the I band and this is also part of the I band. I believe all of you know this thing, sarcomere structure. So, not much time is required here. Okay. Now, the next thing is that why I have kept it here, because this is very simple. I know you have already mocked up all this information, that what is the frequency of different waves. So, first of all, you remember there is an wave in the EEG which is known as the gamma wave, which is seen in very highly concentrated, highly active brain. Means when brains are very active, like for example, you are doing meditation, you are doing solving of the mathematical problem, when your brain are highly active, though that time the gamma wave will be created in the EEG, which has a frequency of 30 to 80 hertz, highest frequency wave in the EEG. But apart from that, normally in our brain, whenever the person is awake, alert, eyes are open, we have already seen that the beta wave will be seen. And whenever you are going from this awake alert stage toward the deep sleep stage, what will happen? The frequency will decrease but amplitude will increase. एक चीज सीख लो कि more active brain, activity of the brain जितना increase होगा, activity, more the activity of the brain, more will be the which component of the EEG? Frequency will be more. Okay. And whenever frequency increases, the waves will be more desynchronized. Okay. Desynchronized means एक wave ऐसा आ रहा है, एक wave ऐसा आ रहा है और एक wave आएगा जो इसके आउट ऑफ पेज में होगा, इसको बोला जाता है डिसिंक्रोनाइजेशन. व्हेनेवर देयर इज डिसिंक्रोनाइजेशन, द टोटल वोल्टेज, okay, the total voltage is going to reduce. But whenever the frequency is slower, like for example this deep sleep delta wave, frequency is very slower, then what will happen? One wave is coming here, another wave will also come in the similar pattern. So what will happen? The total voltage of this will be more. This is known as the synchronization of the EEG. So frequency more means brain is more active. Frequency is very high. Because of the high frequency, waves are not getting synchronized, that is desynchronization. And whenever the frequency is decreasing, means brain is getting less active, but waves are coming at a slow rate. So there is more chances of synchronization of one wave with another. That's why the voltage, the amplitude of the waves is getting increased. So y axis of these waves are amplitude. Okay, this is the amplitude of the wave, and x axis is the time axis. Whenever you are getting x axis is the time axis, obviously EEG में x axis time ही होगा. You try to calculate what is the number of waves within 1 second period. So here the 1 second scale must be given. This 1 second scale will be given in the EEG recording. So within this 1 second period, okay, like for here, you try to calculate how many peaks of the waves you are getting, how many peak of the wave you are getting, 1 peak, 2 peak, 3 peak, 4 peak. So 4-5 peaks you are getting, that means that is the frequency of the EEG wave. But if you are getting a wave like this, frequency is so high that you are not able to count also. Here the frequency is so high, this is not possible to count also. That means that is a very high frequency wave. So whenever the frequency is slow, you can individually pick up the waves, each and every wave can be calculated equally. So that means this is one wave, this is two wave, this is three waves. So all of this peak if you count, then you are going to get the frequency. With the frequency you can easily determine which kind of wave they are, because you have to remember this number. Okay, so time को देखो, amplitude को देखो. Most important is the time, कितना frequency you will get to know. Then you look at the amplitude. If the frequency is very less, तो amplitude क्या होनी चाहिए? Amplitude high होनी चाहिए. Whether that is matching or not, that also you have to check. Okay, and based on that you will be able to identify different waves in the EEG. Now this thing we have already discussed in the previous question, that whenever a person is opening his eyes, which waves number will be decreased. Okay, so देखो, when the person eye are closed, so eyes are closed. Okay, eyes are closed. Which kind of wave you are getting? You are getting huge number of alpha wave, huge number of alpha wave. Okay, so these are the alpha wave. Now whenever the person is suddenly opening the eyes, okay, so what is happening? The frequency has been increased to a very so high that even you are not able to count how many waves, how many peaks are there in between. And look at the amplitude of this wave, the amplitude has been reduced to a very low level. This phenomena, I told you, this phenomena is known as alpha blocking phenomena, alpha block phenomena in the EEG, alpha block phenomena. Alpha block phenomena is synchronization or desynchronization. If I ask you alpha block जब हो रहा है, synchronization or desynchronization. So alpha block means you are getting beta wave. Beta wave means the frequency is very high, amplitude is low. If the amplitude is low, so synchronization or desynchronization, it is desynchronization. So that's why this alpha block phenomena is also known as desynchronization phenomena in the EEG. Getting my point? So this way you have to remember. Okay, chalo. Next, I believe all of you know that ऑक्सीजन हीमोग्लोबिन डिसोसिएशन कर्व जो होता है, ऑक्सीजन हीमोग्लोबिन डिसोसिएशन कर्व, it is a very pet question almost every alternate year. So if you look at the adult hemoglobin, okay, so adult hemoglobin has a particular shape of this oxygen hemoglobin dissociation curve, that is known as the sigmoid Cepheid curve. In this sigmoid Cepheid curve, first of all you have to remember that 50% of the hemoglobin saturation require how much partial pressure of oxygen. This 50% saturation require generally 23 to 26 millimeter of mercury partial pressure of oxygen. So this is known as the P50 of hemoglobin. This is known as the P50 of hemoglobin. P50 of hemoglobin is generally 23 से लेके 26 millimeter of mercury. At least this much partial pressure of oxygen is required. 26 कुछ बुक में 27 भी दे सकते हैं, but 26 is adequate enough. Now whenever you look at the fetal hemoglobin, so what will happen? The fetal hemoglobin, there is left shift. So whenever there is left shift, you can easily see here that left shift means what has happened to this P50 value. The P50 value has reduced near to 19 millimeter of mercury, 19 to 20 millimeter of mercury is the P50 value of fetal hemoglobin. So P50 value of fetal hemoglobin is 90 to 20 millimeter of mercury, that you also try to remember. Okay. Now apart from this fetal hemoglobin, there are certain other cause where there will be left shift of the oxygen hemoglobin dissociation curve. So fetal hemoglobin is there. Apart from that, you remember that whenever you store blood in the blood bank, because you are storing the blood in the cold solution will inhibit the glycolysis process. Because of the inhibition of the glycolysis, the 2,3-DPG will decrease. 2,3-DPG decrease means there will be left shift, because right shift will be caused by increase in 2,3-DPG. Okay, so 2,3-DPG decrease means there will be left shift. Same for the carbon monoxide poisoning. Whenever the carbon monoxide binds with the hemoglobin, okay, the oxygen will not be able to release from the hemoglobin easily, means high affinity state of hemoglobin for oxygen, that is left shift. Met hemoglobin, same for like that of the carbon monoxide poisoning and thalassemia. In all of these cases, there will be left shifting. Okay. Now you can see here in this diagram that myoglobin is also given. Although the myoglobin curve is located on the left hand side of the adult hemoglobin curve, but this is not actually shifting. Myoglobin curve means it is located on the left hand side of the adult hemoglobin curve, but that is not left shifting. This is a normal curve of myoglobin, because myoglobin can bind with only one molecule of oxygen. Whenever oxygen enter in the myoglobin, there will be sudden increase in saturation. Sudden increase in saturation means the saturation is peaking like this. So that's why the myoglobin curve is known as a rectangular hyperabolic kind of curve. Yes, hyperbola. So myoglobin curve is not actually left shift, it is basically rectangular hyperabolic curve. So this is hyperbolic kind of curve. This is a normal curve, although it is located on the left hand side of the normal curve, right? So these are the things that you have to remember for oxygen hemoglobin dissociation curve. And I believe all of you know that what is the cause of the right shift. Right shift का cause क्या होगा? Increase body temperature, increase carbon dioxide, increase acidosis, increase 2,3-DPG. Those are the cause of the right shifting of the curve. Okay, increase body temperature, so temperature rise होगा तो carbon dioxide ज़्यादा production होगा. So increase body temperature, increase carbon dioxide in the blood, increase acidosis, carbon dioxide ज़्यादा होगा तो acidosis भी होगा, and increase 2,3-DPG. These are the causes of right shifting of the curve. Exercise, there will be increase in 2,3-DPG. So 2,3-DPG rise होने का बहुत सारा cause है, like for example exercise, like for example growth hormone, like for example thyroid hormone increment. So all these things will ultimately causes increase in 2,3-DPG. Increase 2,3-DPG means there will be right shifting. Okay. Now, this is one of the curve from where recently the questions are coming up. So, this is basically ventilation perfusion curve ka graphical representation. Whenever you are getting any kind of image in the exam, first of all you try to look at the x axis. So, what is x axis in this curve? This is PO2, this is the alveolar PO2, okay. So, this is the alveolar PO2, alveolar partial pressure of oxygen, and what is the y axis? Y axis is the alveolar partial pressure of carbon dioxide, okay. So, normal VQ ratio is how much? Normal VQ ratio is 0.8. When the VQ ratio is normal, okay, partial pressure of oxygen at the level of alveoli, that is the capital A, is 100 millimeter of mercury, 100 millimeter of mercury, and the partial pressure of carbon dioxide at the level of alveoli is 40 millimeter of mercury, okay. Fine. First of all, you remember this normal. So, when the VQ ratio is normal minus normal 0.8, so this is the position of the curve. This is the position of the curve, means if you drop on perpendicular from here on this axis, so this is basically around 40 and here it is around 100. So, this is the meaning of normal curve. Now, when the VQ ratio is infinity VQ ratio means, okay, so this is V upon Q. So, when the V is normal but Q is equal to 0, Q is equal to 0. So, I should write down here 0, Z0, okay. So, V is normal, okay, but Q is 0, perfusion is 0, then the ratio will be infinity. Examples: pulmonary embolism. So, whenever there is pulmonary embolism, blood flow to the alveoli is 0, okay, but ventilation is normal. So, ventilation is normal upon 0. So, if you divide something with a 0, so that is infinity. So, infinity VQ ratio means in these cases, look at what will happen to the partial pressure of oxygen. So, the partial pressure of oxygen in this condition in the alveoli will be 149 actually, 150 millimeter of mercury, and partial pressure of carbon dioxide in the alveoli. So, see here the curve is touching the x axis at which point? 150 point, but whenever the curve is touching the x axis, okay, everybody look at carefully, when the curve is touching the x axis, what will happen to the carbon dioxide value? The carbon dioxide value is here, that is 0. So, that is why partial pressure of carbon dioxide is near equal to 0 millimeter of mercury. If you want to remember the actual value is this is 149 and this is 0.3, that is the actual value, but simplify you can remember 150 or 0 millimeter of mercury. Actual value दिख नहीं रहा है, अब दिख रहा है 149 and actual value this is 0.3 is the carbon dioxide actual value, but try to remember at least 149, I mean 150 and 0. So, VQ ratio infinity means if the ratio is increased from normal ratio towards the higher ratio towards infinity ratio, alveolar oxygen will be increased, alveolar oxygen tension will be increased. देखो normal oxygen tension is 100, but now the alveolar oxygen tension has raised to 150. So, alveolar oxygen will increase, carbon dioxide will decrease, okay. So, whenever VQ ratio increases from normal to higher, then oxygen increases in the alveoli, carbon dioxide decreases in the alveoli. But if you look at the other side here, so VQ ratio is decreasing from 0.8, it is decreasing to 0. VQ ratio 0 means, VQ ratio means ventilation is 0. So, I am writing here ventilation is 0, perfusion is normal. So, obviously, the whole ratio will be equal to 0, okay. So, when ventilation in an alveoli is 0, but perfusion is maintained, examples of this condition will be bronchial obstruction, okay, bronchial obstruction. So, whenever there is bronchial obstruction, the VQ ratio is 0. Whenever the VQ ratio is 0, in these cases partial pressure of oxygen in the alveoli, you can easily find out from here, you can drop on perpendicular from here. So, partial pressure of oxygen will be 40 millimeter of mercury and partial pressure of carbon dioxide in this alveoli will be 46 millimeter of mercury, okay. So, this is the thing that you have to remember. देखो atelectasis बाद में होगा, but foreign body obstruction पहले होगा, then the oxygen. So, we are just looking at the after obstruction to the alveoli. If there is atelectasis, so gas will be reabsorbed, absorbed from the alveoli. So, that condition is separate condition, but whenever there is obstruction of the bronchioles, immediately what will happen to the change in composition of that alveolar that we are discussing here. Okay. So, whenever there is bronchial obstruction, VQ ratio is 0. VQ ratio is 0 means within the alveoli, what will happen to the partial pressure of oxygen? 40. What will happen to the partial pressure of carbon dioxide? 46. Whenever the VQ ratio is infinity, that means the embolism is blocking the blood flow to the alveoli. Whenever this is happening, the partial pressure of oxygen in the alveoli will be highest, that is 150, and partial pressure of carbon dioxide will be lowest, that is equal to 0 millimeter of mercury. This you have to remember. Okay. Okay. Now we are coming to this Uyghur's diagram. So, in Uyghur's diagram, multiple things are there. Okay. But in this multiple things, the basic thing that you have to remember is that first of all, you can see here that this is the ventricular, okay, ventricular curve, okay, and then you are finding out this is the aortic curve, this is the aortic pressure change curve, this solid line is the ventricular curve. So, if I highlight this aortic pressure change curve, so this is the aortic pressure change curve, aortic pressure change, okay. तो यहाँ पे लिख देता हूँ aortic pressure change curve. Solid line is the ventricular pressure curve, and there is another broken line here. This broken line is the change of pressure within the atrium. So, this is green color curve, basically atrium pressure change curve, atrium pressure change curve. So, atrium pressure change curve means you are going to get certain waves which are like that of the JVP wave, because what is JVP? Jugular venous pressure, that is from the right atrium pressure change. Left atrium pressure will also change in the similar pattern. So, if you look at this green color curve, पहले green color curve से शुरू हो जाओ, green color curve का जो है, so ये जो है, this is the A wave in the atrium pressure curve, this is the C wave, okay, and this is the V wave. Okay, so whenever I am saying A, C and V, now you can easily understand which one is the X descent and which one is the Y descent. So, this is my X descent and this is my Y descent. Okay. Now, you try to remember that in JVP, along with A wave, which heart sound is appearing? समझ में आ रहा है? So, this A wave in the JVP, which heart sound is appearing with the A wave? S4 is appearing. This is the C wave, which heart sound is corresponding with that? S1. This is the V wave just before the V wave S2 is happening, just after the V wave S3 is happening. So, try to remember like that. In JVP, if you have to correlate the JVP wave along with the heart sound, so in the JVP, A wave is corresponding with S4, okay. C wave is almost corresponding with the S1, and V wave is corresponding with the two heart sound. Just before the peak of the V wave, S2 is coming, and just after the peak of the V wave, S3 is coming. ठीक है? Okay. Now you look at the ECG. So, this is the P wave, this is the Q wave, R wave, and I told you already that if you measure the time period from the beginning of the Q wave up to the second heart sound, this QS2 is known as the electromechanical systole. So, starting of the Q wave up to the ending, up to the second heart sound, this is QS2 duration. But question is asked that along with ECG waves, how the heart sounds are appearing. So, along with ECG, look at the diagram. So, this is P wave, just after the P wave, which heart sound you are getting? S4. So, P wave in the ECG means S4 heart sound you are going to get after the P wave. Okay. Then look at this R wave. Along with the R wave peak, which heart sound you are getting? S1 you are getting. T wave ka ending, which heart sound you are getting? Second heart sound you are getting. And the TP segment, okay, which heart sound you are getting? S3 heart sound you are getting. Okay. So, these are the single catch point that you have to remember from this Uyghur's diagram. Otherwise, you may not going to analyze this whole diagram, okay, you may not going to remember them. So, at least you remember this heart sound with JVP means atrium pressure changes, how the heart sound is appearing with atrium pressure changes wave, and how the heart sound is appearing with the ECG wave. Next, you have to remember that which wave is appearing after what, because they are also giving that what is the sequence of the correct thing in the Uyghur's diagram. So, Try to remember like this. P wave, what is P wave? P wave means atrium depolarization in the ECG. Whenever atrium is depolarized, then the contraction will start. Whenever atrium contraction is starting, there will be A wave in the JPP, and whenever A wave is there, means atrium is contracting, it will push the blood towards the ventricle in a rapid manner, and that will produce S4 heart sound. Getting my point? How I am remembering? Okay, so P wave atrium depolarization. Just after depolarization, contraction will start. Contraction means atrium pressure will rise, so A wave in the JPP. Atrium pressure rise means it will push the blood to the ventricle, that will produce S4 heart sound, right? Okay. Then coming to the repolarization, okay, coming to the QRS complex. So QRS complex means ventricular depolarization. So ventricular contraction or systole will start. Whenever ventricular contraction is happening, at the onset of the ventricular contraction, the first heart sound is going to appear, and after the first heart sound, C and X wave in the JPP is going to come. Okay. Now coming to the repolarization, T wave in the ECG. So whenever there is T wave, repolarization means the ventricle is about to relax. Whenever the ventricle is about to relax, the first thing that is going to happen is the closure of the semilunar valves, S2, and after S2 you are going to get the dicrotic notch in the aortic pressure curve. Okay. And then the V wave will appear, and I told you already the V wave before the V wave onset, S3 will be there, and after the V wave the Y descent is going to seen. So this way, this sequence you try to remember, at least try to understand a little bit and then try to remember the sequence, because they are giving questions from here. Okay. Okay, little difficult here, but try to remember. Okay. Now this is an old question of INI-CET. I believe all of you can easily answer. So the glomerular filtration, you know, there are certain substances which are known as the freely filterable substances when the molecular radius is less than 1.8 nanometer. Then selective permeable substances, molecular radius is 1.4 to 4.2 nanometer, and whenever the molecular radius is greater than 4.2 nanometer, the substance will be impermeable. Now in MCQ, what is given? This 3 curve will be given, and they will ask you identify which one is the cationic substances, which one is the anionic substances, which one is the neutral. If you look at the x axis of this curve, first of all you look at the x axis. So this is 18 what? 18 angstrom. 18 angstrom means this is basically 1.8 nanometer, 1.8 nanometer, and this is 42 angstrom. 42 angstrom means basically this is 4.2 nanometer. So whenever it is nanometer, you can easily look at the range 1.8 to 4.2. That means this is basically selective permeable substances. When the substance is selectively permeable, maximum filtration will be seen for positively charged substances, cationic, followed by neutral substances, followed by anionic substances, because all of you know that the filtration barrier contain negatively charged. Okay, filtration barrier is negatively charged. So if the filtration barrier is negatively charged, it will causes attraction of the cationic substances, so more filtration. So obvious thing is that सबसे ऊपर वाला curve, the uppermost curve will be the cationic substances, polycationic dextran. The middle curve is the neutral substances, and lowermost curve is the anionic substances. Okay, because yes, negative charge anions, so this will causes repulsion. Okay, so filtration barrier will causes repulsion, and because of which least filtration permeability. Okay, so this is the filterability of the glomerulus. Now the next thing is that basic electrical rhythm. I told you that already that basic electrical rhythm is also known as the slow wave in the GIT. Slow wave in the GIT. And earlier we have discussed that highest frequency of the BR is seen in which part of the GIT, that is duodenum, followed by jejunum, I told you. Okay, and some of you already told that the lowest frequency of the BR is seen at the level of cecum. Okay, but cecum if not given in the option, then stomach can also be an answer. Even if that is not given in the option, so you can easily find out from here, sigmoid colon can also be an answer. But apart from that, what you have to remember, you look at this diagram here. So this kind of curve, this is the curve which is known as the simple BER. So this green color highlighted portion, this is basically my BER. Whenever BER is stimulated by certain neurotransmitter, normally if the BER is coming up, what is BER basically? BER is the resting membrane potential of the smooth muscle cells of the GIT. BER is the resting membrane potential. So, simple BER, if it is appearing, then there will be no contraction of the smooth muscle, no contraction of the smooth muscle. If there is no contraction, so obvious thing is that the tension in the smooth muscle is not going to rise. So, if you look at this tension, tension is 0 tension here, tension is 0 here. So, when the BER is going on in the smooth muscles of the GIT, only BER means no contraction. So, tension is 0. But now, whenever you are giving acetylcholine, cholinergic neurotransmitter, acetylcholine you have given, so what is happening? You are getting some activity onto the surface of this BER. This activity which you are getting on the surface of this BER, those are known as the spike potential. So, spike potential is basically a kind of action potential which is appearing, spike potential. Okay. So, whenever the spike potential are appearing, now the smooth muscle is going for contraction. Whenever the smooth muscle is going for contraction, what will happen to tension? Tension will rise. So, that is why you are finding out here the spike potential is appearing, and along with the spike potential the tension is also high in the muscle, means muscle is contracting. Okay. Now, rather than giving adrenergic stimulation, rather than giving cholinergic stimulation, if you give adrenergic stimulation, so epinephrine or norepinephrine, so what is going to happen? Now, you can find out here that the spikes are disappearing, no spike you are getting here, spike is disappearing gradually. If the spike is not there, so no contraction again, no contraction. If no contraction is happening, again the tension is going to be reduced. So, here the spike is gradually disappearing, because of which tension is decreasing. That means acetylcholine causes contraction of the smooth muscle of the GIT, adrenaline causes relaxation. We all know that, and this is the explanation that acetylcholine, how it causes the contraction of the GIT by producing which potential? Spike potential, and adrenaline causes relaxation by GI smooth muscle, how? By disappearing the spike potential. Okay. So, BER will go below the threshold, spike potential will disappear, depolarization is not going to happen, relaxation is going to happen. Based on the same concept, another question has been given here. This is basically intestinal movement. Whenever I am saying intestinal movement, this is not the BER, this is not the BER, do not confuse with the BER. BER is the electrical event, but here is the contraction, movement. Movement means contraction, relaxation, that is the mechanical activity. So, this is the mechanical activity. So, if you record the mechanical activity of the GIT, suppose it has been given, a detailed question is I have not written here. Suppose this is the normal movement of the GIT, normal contraction and relaxation. So, this is the contraction of the GIT in the upward direction, okay, and followed by relaxation of this GIT smooth muscle. Normal contraction relaxation is going on. Suppose question में ऐसे बोल दिया कि this is the normal contraction and relaxation of the GIT. Then you have given one medicine, drug. Question was, what is this drug which is given here, because of which, what I am finding out, because of which I can find out that the GIT contraction, which was very stronger, that contraction is gradually decreasing, and now the fully relaxed, okay, full relaxation of the GIT. So, this drug, this medicine is causing relaxation. So, obviously, this is adrenaline was the answer, okay, adrenaline was the answer. But please also remember that rather than giving adrenaline, if you give acetylcholine or barium chloride, or okay, so if you give ACH, this is going to happen. If you give BACL, barium chloride, that is also going to cause this kind of phenomena. Even the KCl can also, okay, very good, the KCl can also cause this kind of phenomena, okay. So, acetylcholine, barium chloride, calcium, potassium chloride, all will causes increased contraction of the smooth muscle of the GIT, but adrenaline will causes relaxation of the smooth muscle of GIT. Got it? Okay. Now, the last image for today. So, in this image, what I want to show you here, look at the thyroid hormone which is produced from the gland is mainly the T4. So, this is the T4 which is produced from the gland. Then we all know that T4 can be converted into T3, that is the most active form of the hormone, or it can also be converted into reverse T3, RT3, that is the inactive form of hormone, all of you know this. Now, Thyroid hormone has a major function which is nothing but the increase in BMR, okay, BMR increment. So, whenever a person is going for starvation, so this is a zone where the person is going for starvation. What you want to do? Will you want to increase the BMR further? Answer is no, because the energy supply is not there. So, BMR's increment is not required here. So, what I will try to do? I will try to decrease the conversion of this T3, and whenever you are decreasing the conversion of the T3, what will happen? Proportionally, the reverse T3, the inactive form, has to be increased. So, gland is producing normal hormone initially. Peripheral conversion of T3 is hampered because the person is on starvation, and what is happening? Reverse T3 is rising. So, the hormone level which is decreasing, okay, hormone level which is suddenly decreasing, this is obviously your T3, and mirror image of this curve will be reverse T3 or T3, reverse T3. And the curve which is not changing significantly initially, particularly not changing significantly, although later on production is also reducing, this is basically your T4. So, basically this was given as an image based question. You have to identify which one is the T3 curve, which one is the T4 curve, which one is the reverse T3 curve. So, mirror image curve which is decreasing, that is the active form of hormone T3, and the curve which is increasing in number, increasing in value, that is your reverse T3, inactive form of hormone, and which is remaining stable initially, later on decreasing, that is T4, total hormone production. Got it? Now, we are coming to the last part of this discussion, that is the important tables and numericals. So, here I have given certain tables. I am not going to discuss them, all of them. So, only important things you have to remember from this table. So, like for here, we have already discussed SGLT1, SGLT2, where they are located. So, no need to discuss further. Only one thing you note down here, GLUT1, where it is located. So, it is the GLUT of the RBC, it is the GLUT of the blood-brain barrier and RBC. And GLUT4, obviously all of you know this thing, biochemistry teacher also taught you. So, this is the insulin responsive GLUT, you should not forget. And insulin responsive GLUT kahan pe hota hai? Muscle and adipose tissue, that is all. GLUT5 you also know, fructose transporter. So, this is the thing that you have to remember from GLUT table. Next question, body fluid measurement. Already we have discussed that there is a principle which is known as the volume of distribution principle, which is equal to Q minus E upon C. So, we have seen in one question that we are going to use the inulin. So, if you are using inulin, which volume you are going to measure? ECF volume you are going to measure. Apart from inulin, sucrose, sodium isotope, iodine isotope can also be used for ECF volume measurement. But question has also been asked, which are the substances used for the total body water measurement? So, D2O, deuterium oxide, tritium oxide and antipyrine is used for total body fluid measurement. Okay. At least you remember these two things. Along with that, this plasma volume, albumin tagged with iodine, 125 isotope tagged with albumin is used for plasma volume measurement, along with that Evans blue. So, at least you remember these three things. Okay. MCQ already aa chuka hai, and future maybe this question is going to come from here. Okay. Next one, the nerve fiber classification. Okay. Again, this table, whole table you do not have to remember, but two things is required, that A fiber, B fiber, C fiber. A and B fiber, they are the myelinated fiber. Okay. A fiber and B fiber, they are the myelinated fiber. C fiber is the unmyelinated fiber, right. Now, A delta fiber and C fiber both are responsible for carrying pain and temperature. Like for example, here you can find out pain and temperature, both are there. But I believe all of you know that this is basically fast pain, because the conduction velocity of this fiber is very fast in comparison to C, and the temperature which is carried by C fiber is the warm temperature. So, obviously, the cold temperature is carried by the A delta fiber. Okay. Apart from that, this proprioception, they are also asking question that what is the conduction velocity of proprioceptive fiber in our body. So, the conduction velocity of the proprioceptive fiber and the motor neuron, they are the highest, the conduction velocity is 70 to 120 meter per second. Okay. So, only this thing is important for this table. Now, hypothalamic nucleus, already we have discussed one thing, that the set point of the hypothalamus, where it is located, anterior nucleus, and we have also discussed anterior nucleus is responsible for hot response, posterior nucleus is responsible for shivering. So, this has already been discussed. Suprachiasmatic nucleus also discussed. Now, you try to remember one extra thing here, lateral nucleus for thirst and hunger and ventromedial nucleus for satiety. Or more than that, a reward center is essential to remember for INI-CET. So, reward center, medial forebrain bundle, nucleus accumbens, medial forebrain bundle and nucleus accumbens लिख के रखो, nucleus accumbens. So, these are the thing that is known as a reward center, and punishment center is a periaqueductal gray matter region, periaqueductal gray matter. Okay. So, periaqueductal gray matter is the punishment center. Okay. So, these are the thing for INI-CET. Enough. Thalamic nucleus. For thalamic nucleus, क्या remember करोगे? One question which is asked in INI-CET is basal ganglia and cerebellum connected with cerebral cortex through which nucleus of thalamus. Okay. So, in this table find out where basal ganglia and cerebellum is written. So, basal ganglia and cerebellum is written here. So, please remember ventrolateral and ventroanterior nucleus of thalamus is responsible for connection of basal ganglia and cerebellum with the cerebral cortex. Thalamus के through क्या होता है? All the ascending tracts, all the fiber which are coming from basal ganglia cerebellum, they are passing through thalamus and then they are going to the cortex. Question is which nucleus of thalamus through which they are passing? Okay. So, like for example, all of you know that the fiber for vision, they pass through the lateral geniculate body. The fiber for auditory, hearing fiber, they goes through the medial geniculate body. Those are common things that you know. And the sensory fiber, they goes through the VPL, ventroposterolateral and ventroposteromedial sensory fiber, somatosensory fiber. But the question they are asking is cerebellum and basal ganglia is connected with cerebral cortex through which nucleus? Ventroanterior and ventrolateral nucleus of thalamus. Okay. Now, we have discussed here the vision, hearing, ये सब special sense हो गया. Now, whenever the special sense is about the olfactory, smell. Okay. So, whenever the special sense is smell pathway, olfactory pathway, they are going through which nucleus of the thalamus? Dorsomedial nucleus of thalamus. This also you try to remember. Okay. Remember करो, जरूरी है. Okay. अब आ जाओ. GPCR receptor, G protein coupled receptor. Question देता है, multiple question देता है. So, what you have to remember? G protein means it can be of stimulatory G protein GS or it can be of inhibitory G protein GI. GS or GI, they are connected with adenylyl cyclase. So, S is the adenylyl cyclase, and after adenylyl cyclase the second messenger is CAMP. But if it is GS, CAMP level will be increased, and if it is GI, CAMP level will be decreased. And after the CAMP, both of this CAMP is going to act on protein kinase A, protein kinase A. So, one will stimulate the protein kinase A, one will inhibit the protein kinase A, but this whole sequence they are also asking nowadays, that if the G protein is stimulated, okay, by a hormone ACTH, what is the sequence? This time of question they are giving. If the G protein is stimulated by MSH, okay, parathyroid hormone. So, whenever the G protein is activated by parathyroid hormone, the sequence is that first of all it is going to act on the adenylyl cyclase, that is going to produce the CAMP. CAMP is going to stimulate the protein kinase A, and then the hormone action is going to be seen. If they are asking about this alpha 2 adrenergic receptor or somatostatin or M2, सब कुछ 2 2 2 देखो. So, they are basically going to inhibit the G protein, means adenylyl cyclase will be inhibited, CMP level will be decreased, protein kinase A will be decreased. Okay. Now, there is another kind of G protein which is known as the GQ type of G protein, GQ. GQ type of G protein is not acting on the adenylyl cyclase, rather it is acting on phospholipase C. After the phospholipase C, it is going to increase the inositol triphosphate and diacylglycerol inside the cell. Now, you all know that inositol triphosphate is going to increase the calcium level within the cell, and diacylglycerol is going to act on the protein kinase C, not the protein kinase A, protein kinase C. So, that is why indirectly they are asking question that which of the following hormone act through increasing calcium inside the cell. So, all these hormone which are written here, they increases calcium within the cell via this GQ type of G protein pathway. Am I clear? Okay. Now you have to remember this hormone name. Okay, try to remember this, that 111 ये सब जहाँ पे है, mainly one V1 receptor, okay, M1 receptor, AT1 receptor, these are mainly acting through this G calcium mediated action. So, angiotensin 2 AT1 receptor is also there, angiotensin 2 AT2 receptor is also there, AT1 receptor is the main. So, you have to remember this way, that it is mainly acting through the calcium. Okay. Now, apart from this, you also know that there are certain other messenger system in the cells which are, they are also asking question, like for example, they already asked that this JAK-STAT pathway, what are the hormone which act through this JAK-STAT pathway? Already question आ चुका है 2 बार, एक बार ये लेप्टिन लेकर क्वेश्चन आया था, एक बार ग्रोथ हार्मोन लेकर क्वेश्चन आया था. सो ग्रोथ हार्मोन, प्रोलैक्टिन हार्मोन, लेप्टिन, एरिथ्रोपोइटिन, thrombopoietin, granulocyte macrophage colony stimulating factor, interleukin, all of them act through JAK-STAT pathway. Never forget the JAK-STAT pathway hormone, because question will come. Okay, question will come. Please remember. Okay. Now, MAP kinase pathway, especially insulin and IGF act through MAP kinase pathway, and RAS-RAP pathway, mainly RAS-RAP pathway, epidermal growth factor and the nerve growth factor, epidermal and nerve growth factor, they are acting through this RAS-RAP pathway. And SMAD pathway इतना famous नहीं है. SMAD pathway के through कौन सा hormone act करता है? Activin transforming growth factor beta and Mullerian inhibitory substances, MIS, Mullerian inhibitory substances, they act through SMAD pathway. Okay. So, this is all for today's session. So, table is done, everything is done. I believe now I will share the MCQ. Sir, please explain stretch, invert stretch. कोई ना कोई सेशन आपको मिल ही जाएगा. स्ट्रेच, इन्वर्ट स्ट्रेच इज वेरी कॉमन, MCQ में डिस्कस किया है. स्ट्रेच रिफ्लेक्स, इन्वर्ट स्ट्रेच. फॉर द स्ट्रेच रिफ्लेक्स, यू रिमेंबर the muscle spindle is for stretch reflex. Okay, stretch reflex, it is a monosynaptic reflex, and Golgi tendon organ is for inverse stretch reflex, it is a bisynaptic pathway. Okay, इसमें जो afferent होता है, afferent for this pathway is a 1A afferent, and afferent for this pathway is 1B afferent. At least you remember this thing, more than enough. Okay, stretch and invert stretch. So, good evening, thank you so much, best of luck for your exam. Okay, keep your head cool, it's very easy to say than do. Okay, so I know it's very difficult to keep your head cool, but I told you already that even if you're getting a little anxiety, even if you're getting a little bit of tension, that is good, because little bit of tension makes you perfect, but huge amount of tension is not acceptable. Okay, but little bit of tension, little bit of anxiety is required. It will make you more perfect, it will activate your brain more. Okay, so your subconscious mind will be more active and you will be able to recall all of this thing. Okay, very common symptoms होता है कि हाँ, preoptic nucleus is a part of the anterior hypothalamus, yes, correct. Okay, so क्या बोलने जा रहा था, भूल गया. Anyway, so bye, take care. Okay, best of luck once again. Thank you so much.